Perfect. So yeah. I was saying that we explained this before, like several times before. If you'd like, we can go through it in few minutes. If you have any like questions as well, we can devote like 10 minutes for Q&A, question and answer session if you would like, if you have specific questioning, if you have some uh, inquiries about the OSCE, how to solve it, how to think, we can devote 10 to 15 minutes if you would like, first, before going to the stations. Okay? So let me know if one of you, please let me know how do you prefer to proceed. One of our Nigerian friends. Where's Manu? Or Heba from Montreal? عايزين ايه يا شباب؟ ندخل على الستيشنز ولا ناخد البتاع ده شوية الاس او اس؟ عايزين ايه بالظبط؟ الشباب المصري ساكت ليه؟ اوكي فاطمة
السلام
كود.
عليكم يا دكتور. نبدأ في الاس
وعليكم
او اس.
السلام.
أنا أول مرة أبدأ معاكم.
انت اول مرة تبدأ معنا. اوكي
أنا آسف، أنا بعتذر، أنا كان نفسي أكون قديم يعني.
لا اهلا بيك، شرفتنا دكتور احمد، مش كده؟
إن شاء الله.
عراقي؟
لا، فلسطيني والله.
فلسطيني، اهلا بيك اهلا بيك اهلا بيك.
أهلا فيك يا دكتور محمد، شكرا.
قلوبنا مع فلسطين، قلوبنا وعقولنا مع فلسطين. ماشي،
يا رب.
يلا بينا، توكلنا على الله. خلاص نبتدي SOS ان شاء الله. So yeah, we're gonna start with the SOS, guys. I'm gonna give you like a brief about what's all about the SOS. The standardized OSCE scheme. I think the title tells the story. So this is a OSCE scheme. It's not like mandatory one, but you know, it's like a way of structured method that you can use to solve the OSCE stations. It could be applied to most of the stations. You will find some questioning, 3 parts: assessment, counseling, and follow-up. The 3 major parts of the OSCE scheme is the assessment, counseling, and follow-up. You can see my screen, correct? So yeah, we have some questions here. So during the OSCE station, you are not obligated to pose all these questions. You can only, it's like tailored. You have to tailor your question according to the case that you have, according to the medical problem or the medical condition that you have. So, but anyhow, we try to list as much as question as possible to be like a comprehensive way to solve the OSCE stations. But at the end of the day, it will differ from one station to another. Okay, so let's start by the assessment. First thing to do, I think you have to, of course, you will have to greet the patient, which is the actor here, to introduce yourself and offer privacy. This is very important. Okay. First, you will step into the assessment phase. So you have to make sure that the station either it's like a new prescription or it's like a refill. It's only for or even for a counseling or anything. You have to understand for whom the service is. Is it for the patient himself, the person, the actor himself, maybe for his father, his mother, or whatever, his kid? So you have to ask him first for whom. If you have a patient profile, if you have a new prescription or something, first thing to do is to go through the patient profile. Ask about the medical conditions. What medical condition you have? Yeah, if it's yes, if he's taking prescription, yeah. Simone, if you can mute, please. Yeah, I muted you. Okay, sorry. So yeah, if he, yeah, you should ask if he's taken some prescription and prescription medications. Herbal vitamins over the counter. Allergy question is one of the most important questions that you have to pose. If there is any pain, if it's like a counseling about a pain or something, you have to ask how bad the pain is, how bad the pain is on the pain scale. What type of pain? Is it like radiating? Is it stabbing pain? What type of pain? Pregnancy, breastfeeding, guys, for sure it will be for women, as only for women. We don't pose this type of question for men. So weight in some cases could be important issue as well, like in pinworm. If you have a pinworm case, if you have an antibiotic, for example, for kids, malaria, Plan B, etc., all of this and many other indications, weight could be very relevant to solve this station. Okay, to make sure to keep the weight question in mind. Profession as well could have some relevancy to the case. Like if he's like the patient is a minority worker or something, allergy could be a concern here. Where in the world, where in Canada he lives as well, it could have an impact on dermatitis, if he asthmatic or not, etc. So profession could have an impact as well. Exercise is like one of the routine question that could have some benefit, especially if cardiovascular concern or something. So exercise, eating habits, alcohol, caffeine, smoking. If you have a medical condition, certain medical condition, you have to check for red flags. If you can't treat this case at the pharmacy setting, or you have to refer him to for a medical evaluation. Checking for red flag is very important, very, very important as well. Okay. At the end of the day, at the end of the assessment, you will ask for if any other concern. Make sure, please. Yeah. Make sure, please, before going to check any reference, to pose this question. I repeat that in every session. Okay, before you go in for the checking the reference stage, you have to ask this question. Do you have any other concern apart from what you have told me? For example, ask the patient for that, the actor for that. Do you have any other concern? Would you like to share any other information with me, etc.? Okay, you will save any other hidden concern at the patient if you pose this question to him before going to the reference. If he has any other concern, hidden inquiry, you will avoid any surprises afterwards in the last minute surprise. You got me? Do you understand me? So if you have as much as concern as much as inquiries or questions that you gather before going to the reference, you will give yourself a good time to check the reference, to gather the information, collect the necessary data that you need. Then you can step up to the counseling phase with like in good shape. You will have you will understand the concern. You will be looking for the answer in the reference. You will come back with a good answer, with like well-organized answer to this case. You understood? Did you understand me, guys, here? فهمتوني يا شباب هنا في الحتة دي؟ يعني فهمتوني أنا عايز أقول إيه في القصة دي؟
واضحة يا دكتور.
طيب. Okay. So anyways, assessment phase is one of the most important phase in any OSCE station. You gather information. The most important is to understand the dilemma, to understand the medical condition, the medical problem here, the therapeutic problem, and understand the patient condition. And if any other concern, then you will have to check your reference to gather the information and answer this therapeutic problem. Okay, here's some this should be the a comprehensive scheme for the assessment. You will not in my perspective, you will not be in need to pose any other further question than those. Okay, So yeah, prescription, non-prescription, vitamin, over-the-counter medication, allergy, if there's any pain, pregnancy, weight, profession, etc., exercise, eating habits, and etc. Okay, so hope this clear. I hope this part is clear. Okay. What we are trying to say here, the assessment should take around 2 to 3 minutes maximum. 2 to 3 minutes maximum to do the assessment. So you have to be like well trained, well practiced on the how to pose these questions in a well organized, structured manner, and the most important, like not in a not in a time consuming manner. You got me? So you have to be like quick. You have to be fast, well organized, and etc. to finalize the assessment within 2 minutes maximum, no later than 3 minutes. Okay? Then you will have to devote like 1 to 2 minutes to review your assessment, to check the reference, and prepare for counseling. Here we are talking about like 2 to 3 minutes assessment, 1 to 2 minutes for check the reference and prepare for counseling. So we will come up to around from 4 to 5 minutes now. Okay, there will be 2 minutes remaining. Counseling should take around 1 to 2 minutes, the remaining. So you will give the counseling. You will answer here the therapeutic problem. Do not forget if it's a new medication. Do not forget to go as it mentioned here. Indication. What type of medication is it? Like doctor prescribed atorvastatin, Lipitor, for example. Lipitor is like a medication that we give to lower the cholesterol level. It contains an active ingredient called atorvastatin. It should be effective to treat your condition, etc. You will not feel any improvement, but we will have to make a follow-up with this medication from now and then to make sure it's working very well on your cholesterol, etc. Okay, you will give some brief, and in mentioning the indication, efficacy, safety, what type of side effects should be expected, and if there is any way to manage these side effects, you have to mention it. Better to mention it. Compliance as well. If the patient has to take it with or without food every day, every now and then, every once per week, and etc. Okay. Most important part as well is the follow-up. Okay. If there is any non-pharm technique, mention it here in the follow-up. Any non-pharm technique, when to see the doctor, when you're gonna follow up with them, if the patient is in need of vaccination. If the patient is in need of vaccination, diabetic patients, immunocompromised, elderly patient, vaccination is very important for those populations. Okay. Follow-up is important. Follow-up should be done in 20 seconds, 20 to 30 seconds. You don't have to tell stories and follow-up, So it's only like يعني جملة ورد غطاها. Okay, as we say. Okay, we will follow up with you. I'm gonna call you in 1 week. It's 2 weeks and etc. اللي عايز تقوله قوله يعني في الحتة دي. اوكي داكور ده كده in simple way, like in brief, this what we mean with the standardized OSCE scheme, guys. Assessment, pose as many questions as you have. Relevant question, please. Relevant questions. Okay, this is very important. Only relevant questions. This is important, and you will be evaluated on this. Okay, so make sure. So assessment should take, as mentioned, 2 to 3 minutes maximum. Checking the reference would take 1 to 2 minutes. Counseling should take around from 1 to 2 minutes. Follow-up, 20 to 30 seconds. That's it. تمام.
اوكي.
قشطة. حاجة مش واضحة. Any questions guys؟ نظام عايز تضيف حاجة على اللي أنا قلته؟
لا يا دكتور تمام. لو حابب انا ممكن اعمل سمرايز كده بسرعه in Arabic يعني.
سمر يا
بس
باشا بالعربي.
اوكي.
قول.
تمام. السلام عليكم. انا احمد نظام زميلكم يا جماعه. هي زي ما الدكتور محمد قال، هي الفكره الاساسيه كلها والمهمه جدا في مرحله الاسسمنت، لان دي اللي على اساسها انت هتحل الكيس. على اساسها هتبقى عارف انت رايح فين، هتوجه الكيس لايه، هتروح تبص في ايه في الريفرنس. وبتتحاسب عليها في حاجات كتيره جدا، يعني في جزء الكوميونيكيشن، وده جزء مهم جدا في الاوسكي، وعلى اساسه في ناس كتير جدا بتسقط وناس كتير بتنجح. في ناس بتعرف تجيب الاوت كام كويس، بس الكوميونيكيشن بتاعها فيه مشكله. وانا بقصد بالكوميونيكيشن هنا مش اللغه، مش الانجليش قوي، لا انك قدرت تتواصل مع المريض كويس، تساله الاسئله اللي هي الريليفنت فعلا للكيس. قدرت تغطي كل الاسئله المهمه. سالت البيشنت وانتظرت سمعت الرد بتاعه. في اكتيف listening موجود. فالاسسمنت تقريبا هو 90% من الكيس. لو انت قدرت تعمل اسسمنت كويس، الكونسلنج بتاعك هيكون كويس، الفولو اب بتاعك هيكون كويس. الاسسمنت زي ما الدكتور محمد قال، هي الفكره كلها اول حاجه طبعا المفروض تعرف نفسك. هاي ماي نيم از احمد I'm the pharmacist in duty how can I help you، اللي هو introduce yourself. وبعد كده المفروض تبدا تعرف على البيشنت. may I have your name may I have your birthday whatever. فالانترودكشن ده مهم جدا، بيولد ما بينك وبين البيشنت زي رابورت او جود ريليشن شيب. ودي بتتحاسب عليها في الامتحان، دي اول حاجه خالص تحاسب عليها في الامتحان. وبرضه بتدي لك نفس شويه كده انك انت تكسر الرهبه بتاعه الامتحان، يعني في اول كام سنه. بعد كده بتقعد البيشنت. بعد كده اول حاجه المفروض تعملها انك تبص على تشوف الكونسيرن اللي هو جاي بيه ايه، يعني هاو كان اي هيلب يو. هيبدا البيشنت يقول لك المين كونسيرن بتاعه. المفروض بعد كده تبدأ تمسك الفايل اللي قدامك البروفايل، تبدأ تتابع تشوف ايه الميديكيشنز اللي البيشنت ده بياخدها. قبل ما تخش على طول وتجاوب الكونسيرن بتاعه، المفروض تبدأ تسأله بقى الأسئلة بتاعت الأسسمنت. إيه والله ايه الميديكال كونديشنز اللي عندك، او according to your profile انا شايف ان انت عندك 1 2 3 4 5. ده مظبوط؟ اه مظبوط. Do you have any other medical condition؟ اه او لا. بعد كده تبدأ تخش على الميديكيشنز اللي بياخدها. طب انا شايف في البروفايل بتاعك انك بتاخد 1 2 3 4 5. مظبوط مظبوط. طيب بتاخد اي ميديكيشنز تانية اه او لا؟ والحاجات دي طبعا المفروض تبقى سريعة شوية. بعد كده في اي الرجي، في اي updates regarding your allergy، ده كله في الاسسمنت وحاجات اساسية ما ينفعش تتخلى عنها. بعد كده شوف هل بياخد اي اوفر ذا كاونتر ميديكيشنز، هيربال، فيتامينز. كده انت عملت فول اسسمنت للميديكال كونديشنز بتاعت البيشنتس والميديكيشنز اللي بياخدها والالرجي بتاعه، وقريت الفايل بتاعه. ده هتلاقيه داخل معاك في لما تشوف النتيجه النهائيه ان شاء الله بتاع الامتحان، في كذا بيلر انت بتحاسب عليه: كوميونيكيشن، سيفتي، حاجات كتيره ممكن نبقى نشير معاكم ان شاء الله الريزلت مثلا بتاعت واحد نجح واحد ما نجحش ولا ايه، عشان تشوفوا الحاجات دي مهمه قد ايه فعلا، وازاي بتنجح ناس وازاي ما بتنجحش ناس. بعد كده زي ما الدكتور محمد قال، في بعض الريليفنت كويستشنز اللي انت ممكن تسالها بتبقى مرتبطه بكيسز او كيسز لا. زي مثلا في واحده داخله سنها ما بين 18 و 45 سنه، بيكون في تشانس اوف بريجنسي او بريست فيدنج، فده سؤال مهم جدا انك تساله. لكن مش هتساله واحده عندها 50 سنه مثلا، او مش هتساله الشاب، او مش هتساله واحده مثلا تحت 18. فده سؤال بيبقى ريليفنت في بعض الاحيان. آه، نفس الفكرة برضو. البين سكيل، لو هو أساسا داخل بيشتكي إن هو عنده بين، فده بيبقى هنا ريليفنت في الحتة دي. تسأله على اللوكيشن بتاع البين سكيل بتاعك عامل إزاي، السيفيريتي عاملة إيه. بعد كده تبدأ تدخل تسأل أسئلة تانية خاصة باللايف ستايل بتاع البيشنت بقى. وبرضه مش هتسأل على كل حاجة، يعني في كيسز معينة مثلا انت مش مهمة الدايت فيها قد كده، في كيسز تانية مهمة، يعني بيشنت دايابيتك، بيشنت عنده ديسليبيديميا. مهم انك تساله على الدايت بتاعه. مهم انك تساله على الكحول كونسامشن. مهم انك تساله هو سموكر ولا لا. مهم انك تساله مثلا على الكوفي انتيك مثلا، ممكن تسالها في كيس هايبرتنشن، ممكن في كيسز تانية ملهاش اي علاقه، ملهاش اي لازمه، عشان توفر وقت. لان الاسسمنت فعلا لو طول معاك، دخل في 4 دقايق ولا دخل في 5 دقايق زي ما بيحصل في معظم الناس، والجرس رن عليك، مفيش وقت اصلا تروح تبص في ريفرنس بقى او تحل الكيس. تمام. كيسز اللي هي بتبقى غالبا اوفر ذا كاونتر، او بيشنت جاي عايز يعمل ريكومنديشن، يطلب ريكومنديشن منك، او جاي مثلا اي انفكشن او اي حاجه، فبتبقى الريد فلاجز اسئلتها مهمه جدا، وهي الكيس اساسا اللي هتحدد على اساسها انت هتحول البيشنت ولا انت فعلا هتساعده في قلب الصيدليه. قبل ما تسال الريد فلاجز، انا شايف انك انت الاول تسال البيشنت ايه المشكله اللي هو جاي بيها، وتخليه يقول كل اللي عنده، ما تقطعوش خالص. وبعد كده تساله السؤال المشهور بقى، يعني do you have any other concern? would you like to add anything else؟ تمام. لو قال لك لا، ابدا انت خش بقى بدورك واساله على الريد فلاجز. Okay, I would love to ask you some more questions related to your or regarding to your case, just to make sure we can help you here in the pharmacy, or to rule out any underlying medical condition that may require like medical attention. وابدا اسال بقى الريد فلاجز بتاعتك كلها. تمام. يبقى ده برضو نوع من انواع الاكتيف listening. انت استمعت للبيشنت، خليته يقول كل السيمتومز اللي هو جاي بيها، سالته هل في اي اذر سيمتومز ولا لا. بعدين انت بدات تسال اسئله زياده بقى، اللي انت حابب تتاكد من خلالها اذا كنت تقدر تساعد البيشنت ولا لا. بعد كده جزء الريفرنس زي ما الدكتور محمد قال، لازم تروح تبص عليه، وده بتاخد عليه درجات. الناس اللي بتبص، انا اعرف واحد لسه باعت لي الريبورت بتاعه، آه، من الايشوز الكبيره اللي موجوده عنده في الامتحان، ان هو ما كانش بيبص في الريفرنس، واخد فيها درجه سيئه جدا. فانت حتى لو عارف الاجابه، افتح الريفرنس قدام الاسيسور، وحاول تطلع الاجابه منه، وحاول تقولها من الريفرنس، بحيث انك تاخد الدرجه بتاعت الريفرنس يعني. بعد كده لقيت الاجابه بتاعتك موجوده في الريفرنس، المفروض بقى تبدا تعمل كونسلنج على كل حاجه بقى. تمام. والله دي كيسه بيك اب، دي كيسه اوفر او تي سي، مش
Sorry,
هتفرق
Nezam.
طالما.
Nezam said,
نعم.
guys, we will be back to English, okay? Just the colleague Ahmed Nizam is just explaining something in Arabic to the colleagues. For our non-Arabic speakers, colleagues, we will be back to English very soon. Okay.
Yeah, I'm sorry. It's just like Dr. Mohammed is way better than me in English, so I'm just like to summarize some stuff in Arabic for the majority of Arabian pharmacists, and Dr. Mohammed may cover everything in English. اوكي. فبالنسبه للكونسلنج، الكونسلنج طالما هتطلع ميديكيشن او جاي بيشنت يعمل بيك اب، لازم تشرح كل حاجه خاصه بالميديكيشن. فالطبيعي جدا اصلا ان احنا لما بيبقى فيه دواء، لازم نقول الدواء ده بتاع ايه، ايه الماده الفعاله اللي موجوده فيه، بيستعمل لايه. بعد كده نبدا نتكلم بقى ازاي الدواء ده هناخده مثلا، هاو تو يوز الميديكيشن. بعد كده الدواء ده الأونست بتاعته المفروض هيشتغل خلال قد ايه. الدواء ده مثلا بيستعمل فور بين، فده المفروض بيشتغل بسرعه، لا ده بيستعمل لحالات كرونيك، ده هياخد وقت اطول. دي حته مهمه جدا، الانست والافكس بتاع الميديكيشن. بعد كده السايد افكت بتاعت الدواء، مش هتقول طبعا كل السايد افكت، انت حاول مثلا تختار ايه 2 او 3 موست كومن سايد افكتس، وحوالي مثلا 1 أو 2 رير سايد افكت مثلا. تمام. الالرجي برضو، لا دي حته مهمه جدا، لازم تنبه البيشنت عليها، خاصه ده لو نيو ميديكيشن هياخده. So if you develop any rash at any time, hives all over the body, along with مش عارف swelling in face or tongue, blah blah blah, you might be allergic to the medication. You have to go to the emergency right away and stop using the medication. دي حته مهمه جدا، المفروض تقال مع اي دواء جديد patient بياخده جديد، اللي هي الانافلاكسس. بعد كده المونيتورنج من الحاجات المهمه جدا جدا، وبتحاسب عليها في السيفتي، في البيلر بتاع السيفتي. مونيتورنج لحاجات كتيره بقى، مونيتورنج للكونديشن نفسها اللي البيشنت بيتعالج عليها. يعني وليكن مثلا ده بيشنت جاي عنده ديبريشن، هتعمل مونيتورنج لايه؟ مونيتورنج للسيوسايدال ايديشنز اللي ممكن تحصل في اي وقت. مونيتورنج للكونديشن نفسها بتاعت الديبريشن، يعني if you feel like the condition gets worse at any time, uh, you have to report this to your doctor. حاجات لازم تنبه البيشنت عليها، خاصه مش بس بالدواء، تمام، ان لو حصلت لك سايد افكت او كده بكلمنا. لا، مونيتورنج كمان للكونديشن، مونيتورنج للافكتس بتاع للامبروفمنت بتاع الكونديشن او الورسنج بتاع الكونديشن، بحيث البيشنت نفسه يبقى عارف هو متوقع ايه بالنسبه للدواء، متوقع ايه بالنسبه لحالته، وايه الاكشن المفروض ياخده لو حصلت مشكله معينه. بس يعني ده في بعض بقى الحاجات الأخيرة اللي ممكن تضيفها، يعني بعض السيلف كير ميجرز، ودي بتبقى حاجات كويسة جدا. ولو في فرصة إنك تخلي البيشنت ده يشوف دايتيشن أو أي هيلث كير بروفايدر تاني، دي برضو حاجة ممكن تاخد عليها نقطة زيادة في الامتحان. إنك عملت كولابوريشن مع الأذر هيلث كير بروفايدر. بيشنت دايابيتك مثلا، والله أنا رأيي إنك تبقى تحاول تتابع مع إيه، مع دايتيشن يظبط لك الدايت بتاعك. حاول تعمل شويه اكسرسايزز. بيشنت مش عارف عنده rheumatoid arthritis I would recommend like seeing a physiotherapy. دي شويه حاجات كده بتبقى داخله في السيلف كير ميجرز وداخله في الكولابوريشن، فبتضرب عصفورين بحجر، انك انت بتزود النقاط بتاعتك في الامتحان، البوينتس بتاعتك في الامتحان. فده اجمالا كده يعني الدكتور محمد قاله. يعني لو في حد عنده سؤال ده تحت امرك.
Okay, my friend. Thank you يا أحمد يا نظام. شكرا يا باشا. Okay, شباب. So I think we have good terms now. If you have any questions, if you would like to inquire about anything in OSCE, please feel free to ask for it. Okay. أي أسئلة؟ كله تمام؟ All is clear? Should we proceed to the stations? So far, so good.
Okay, let's go.
Okay. How many of you in Quebec, guys? How many of you lives in Quebec?
أنا بمونتريال.
مين أنتي؟ دكتورة بنان.
بنان.
كيفك يا دكتورة بنان؟
الحمد لله، كيفك دكتور محمد؟
أنتي في مونتريال.
بمونتريال.
في مونتريال هبة برضو.
امم
تعرفوا بعض؟
ايوه
نعرف بعض.
والله. تمام. حد تاني في كيبك؟ Any other Quebecois? No Quebecois here? Okay. iPhone. Okay, good. Where are you? Where are you? Where do you live? Montreal as well? حد في اوتاوا؟ Anybody from Ottawa?
أنا في أوتاوا يا دكتور محمد، تفضل.
اهلا دكتور احمد، انت جاري يا عم، انا في جاتينو.
بدك شاورما من أوتاوا حاجة؟
والله لسه الديك الملكي كان
ديك
ريحته
ديك
معدية من قدامي النهار.
جالي تسمم من آخر مرة أكلت منه.
جالك تسمم؟
لا والله مش عارف، الجاش تاعه هرمونايزد كثير يا رجل.
مش مشكلة بس طعمه حلو.
والله طعمه حلو بطيخ يا رجل.
تعيلك شوية بس اتبسطت. كلت.
مطعم فاشل ده. انت شريك فيه يعني ولا شيء؟ ولا انا اسف لكون بغلط فيه.
انا اللي بودي له الدجاج. انا اللي بورد له الدجاج
تودي له
المتعبة.
فراخ.
انا بتاع الفراخ. Okay, guys. So we're gonna start now the OSCE stations. Okay, how it works here? We will have 7-minute station. Okay, as you know, one of either me or my colleague Nezam will do the actor. Okay, and one of you will come as volunteer here to solve the station. We have only 2 trials for every station. Okay, if you fail, if the first colleague couldn't manage to answer therapeutic problem in the station, we're gonna retake it with another one. Okay, if the second guy couldn't neither to solve the station, at this case we will do the assessment and we'll do the we will give you the answer for every station right away after. Okay, so we have a tier of 2 trials per station. If the first colleague succeeded to answer it, to address the therapeutic problem from first shot, from first trial, then we will no need to retake the station. We're gonna proceed to the second station as well. Okay, so here we go. Do not give any hints, any clues in the chat or in the Telegram group, please, during the station. While the station is running, do not give any clues, any hints, or anything. Okay? Share your comments after when the station is done. Okay? تمام? Okay, good. All is clear. D'accord. نقرا الفاتحة. Okay. Here we go. Station number 1. We need first volunteer. You can raise your hand. If we have more than one volunteer, you can only raise your hand, and we're gonna pick up one from you guys. Or if we have okay, بنات يلا بينا.
Okay, this is my reference.
Yeah, I'm gonna send you the reference. You are in the Telegram group, right?
مظبوط.
Okay, I'm gonna send you the reference for this station to the Telegram group.
Okay.
There we go. This is the OSCE. Yeah, you will have two references.
You sent
Yeah,
you sent it already now?
here you go.
Okay.
Yes, you should have it now. In the Telegram group, you will have two files, two references, okay? You will
Yes.
have only 30 seconds
Okay.
before we start. During this
Okay.
30 seconds, you can go through the reference if you would like.
Okay.
Okay? Nizam,
Okay.
can you take the timing for me, please? Can you watch the
Yeah,
timing?
sure.
30
Okay.
seconds, 30 seconds, then we're gonna start the 7 minutes. You have to alert us 2 minutes before the station ends. Okay?
Okay.
There you go. So you have 30 seconds now, Banat. Go ahead.
Okay. And you will tell me that I have to start or I have to start directly?
Yeah, I'll tell you.
Okay.
Go ahead.
Okay. Hi, my name is Danan. I'm the pharmacist of the duty for today. How can I help you, doctor?
Yes, hi, Banan. Yeah, actually, I'm here. I'm like a new family doctor here to the hospital. I have a question about one of the patients. We have a common patient here. His name is Hamubika. He's 39 years old, and you have his file here in your pharmacy.
Okay, thank you, doctor, for coming to our pharmacy. I will make sure to answer all your concern. So the patient's profile in front of me. So what's your concern for today, doctor?
Okay, this guy is traveling. You know, he's Egyptian and he's back to Egypt during this time. I'm a little bit skeptic about his, you know, diabetes. His diabetic guy, type 1 diabetic guy.
Okay.
And you know, his like his glycemia is not well controlled. So I increased recently his insulin, the Levemir dose, Humalog dose, and etc. And I would like to understand the situation. Should we like make any measures, do any adjustment to the insulin while he's traveling, and how to monitor as well the glycemia, you know?
Okay, sure, doctor. Do you know,
John,
doctor,
come
when
out
he
from
will travel? After how many days?
come out from there.
He will travel. Yeah, he will be traveling in 5 days.
Okay. Okay, doctor, so in front of me in his profile that he is taking aspirin 81 milligram. If there is any side effect that he feel from it, or everything's good with him?
No, it's good.
Okay. Okay, and about his Humalog, is everything is good also with him? Does he
Yeah,
have
I think,
any
yeah,
side effect from it?
as mentioned, yeah, I increased his dose
Okay.
recently from all insulin by 1 to 2 units.
Okay, okay, okay. And also his amlodipine, right, doctor?
Yeah, correct.
Okay. Does he has any other medical condition other than diabetes?
Yeah, he's hypertensive.
Okay, he has a hypertension. Okay. Does he has any allergy?
No allergies.
No allergy. Do you know, doctor, do you have any idea that if he has any over-the-counter medication?
No, maybe some vitamins or something.
Okay.
Not beyond.
Okay. Okay, doctors. So doctors, let me let me check my reference, and I will back to you.
Yeah, sure, go ahead.
Okay, thank you, doctor. Okay, thank you, doctor, for your waitings. So according to my reference, which is a travel travel guidelines, as our patient he will travel to East. The guideline recommendations is it's usually to reduce the bedtime dose of the basal insulin, which is the Levemir. Our patient he is taking 10 units in the night. So it's better that we will reduce the units for him, and just give me a second
Why
to
should we
back to my
reduce it?
reference.
Why should we reduce it?
Because when you will traveling to the east, it will be less hours, and the patient he will need less long-acting insulin, and he will have less sleeping hours. Because of that, we will decrease the units for the sleepings for the patient, to not make the patients enter in hypoglycemia, and
Okay.
that's
What
it.
about the other insulins, the Humalog?
Just give me a second,
Should we
doctors, and I will.
compensate that? Okay, should we compensate the reduction in basal insulin with the
2
bolus one?
minutes left.
Okay. We have to decrease decrease the intermediates or the long-acting insulin, and because he will has a long flight, so I recommend to decrease the long-acting insulin, which is the Levemir insulin. We will decrease the unit for him, and
Yeah. Yes. Go ahead.
so we will take like 1/3 of the day. So if the patient like is flying to the east, he is taking 1/3 of the day. So the total insulin it will be reduced to the 1/3, like 33%, and this it will
This
be
is for the
better for.
basal one, right?
Yes, it will be for
Okay.
the basal rest. Yes.
Okay.
So
So can you please tell me if you I don't know, as well as mentioned, this is like a new patient for me, and I'm a new family doctor. What do you think about his therapeutic plan now? Should we add some other medications? Should we adjust some doses? I don't know.
okay, sure,
I
doctor.
don't
So
know.
let me
I
check.
believe that we should, yeah, we can add some
Okay.
medication to
Sure, doctor. So,
help
doctor,
him.
you mentioned for me that his blood glucose it's not controlled. So, what his was is A1C, and what was his target?
His target is below 7.
Okay.
A1C was 8.2.
Okay, his was 8.2. Okay. So
Time
Okay.
off.
Are you there?
times, yes. Just give me a
وين
second.
رحتي؟ وين رحتي يا بنات؟
بفتح
Okay.
الريفرش
So good. Okay.
Okay.
So تمام.
Time's up. Time's up. خلاص.
Time's up.
Yeah.
Well
Time's up.
done. Well done. Well done. Well done. I have some comments. I'm gonna share you my comments after we
Okay.
leave the station with one of the other colleagues. But
Okay.
very well done. Okay.
Okay.
هقول لك دلوقتي يعني هقول لك بعد الستيشن دي انت عملتي ايه بالظبط
Okay.
كويس وايه الحاجة اللي كان ممكن تظبطيها اكتر. Okay.
Okay.
So
تمام.
we're gonna retake the station, guys. If we have other interested volunteer. مؤمن والي. يلا يا مؤمن.
يا باشا ازيك طب
على
الريفرنس صباح الورد. الريفرنس طيب لان انا مش عارف هو فين.
انت مش على الجروب يا ابن بلدي؟
انت حاطه على الجروب يا كبير. طيب ثانيه واحده.
على الجروب يا ابن بلدي يا مصري.
طيب ماشي اللي هي ده ستيشن 1. طيب
في
ماشي
اتنين ريفرنس عندك يا مؤمن.
اوكي اللي هو ستيشن 1 دوت دول كام ورقه اطبعهم كده ولا كتير ولا ايه؟
لا مش كتير، ده التلخيص بتاع الدايابيتس كندا جايد لاينز.
طيب خلينا
والتاني ستيشن 2 كده الريفرنس بتاعك يعني.
اعملهم ثانيه واحده اطبعهم.
تطبعهم
بسرعه بسرعه
طب يا
ثانيه.
باشا 100 شغل جامد والله.
شغل فاخر معنا شغل خوازيق كفايه
اسكندراني
مش
شكلك. اسكندراني
اه
شكلك ولا
بحيره يا كبير.
يا خبر منين؟ ما تقوليش ابو المطامير.
لا انت من المطامير ولا ايه؟
انا من ابو المطامير اساسي.
لا يا راجل انا من كفر جواد اساسا.
مش يعني بينا 5 جنيه كبوت.
اه 5 جنيه.
اهلا بيك اهلا بيك.
انا اشتغلت ابو المطامير زمان وانا مندوب يعني. اول ما اتخرجت اشتغلت ابو المطامير. كانت المشوار بتاعي قريب بالنسبه لي.
والله ابو المطامير هيصة شوية.
ظريفه. اصل انا ما كانش معايا كفر الدوار كمندوب فكانت ابو المطامير بالنسبه لي دي الفسحه ان انا رايح لورا البيت يعني.
انت كنت في شركة ايه؟
كنت في نوفارس.
اهلا بيك اهلا بيك.
ثانية واحده طيب. ادبس
Okay يا
الراوتر.
باشا take your time. Yes when you're just let me know when you're ready.
ماشي اوكي شوف البروفايل.
Okay.
تمام ريدي.
Volunteers for next station please get prepared.
Okay.
Whoever would like to take next station as volunteer, station number 2, you can raise your hand. You can start raising your hand from now. Okay. We have Dr. Mu'min. He's gonna take this one.
Okay.
Very good. So we have Ahmed and Mohamed Awid. Okay يا شباب. نظام will get started على طول. Okay.
Okay.
عشان هو يعني مش هندي 30 ثانية يعني 7 دقايق على طول.
تمام.
7
Okay.
minutes directly.
انا برضو ما سمعتش الكيس اللي فات على فكره يعني بس ده شغال يعني معاك. يعني ما غشيتش حاجه.
يلا بينا يا باشا.
Okay.
طبعت.
Okay.
ادخل.
يا جاهز. ريدي.
Okay.
Let's
Go.
go.
هاي.
Yes, hi. My name is Dr. Jameson. I'm a new family doctor here to the hospital. I have some questions about one of the common patients between us, Mr.
Sure
Hamu
doc.
Bika. Yeah.
Yep. Sure, Dr. Jamison, I'll help you with that, but may you have a seat first in our private area and make yourself comfortable. Tell me more about the patient. What's going on?
Yeah, he's a
Okay.
diabetic type 1 diabetic patient. He's 39 years old. He's traveling to Egypt. He's Egyptian, so he's getting back there. He's getting back to Egypt. You
Yeah.
know, this guy is like recently his blood pressure, his diabetes was not like not in good shape. So I decided recently, about 10 days ago, to increase his insulin dose by 1 to 2 units for both the basal and bolus one. So I'm a
Okay.
little bit worried about the travel. So I would like to make sure that he will take the right insulin. If any adjustment is needed as well, this would be great to share with me.
Sure, Doc.
As well, I would like to check on any chances to enhance or improve his therapeutic plan. If you can recommend me any other addition, if we can remove 1 or 2 medications, I don't know. So if you can have something to say as well for the therapeutic plan, this would be great.
For
Yeah,
sure,
thank
doctor. I'll help you with that. And thank you for asking me about this patient. So the patient name is Hamobika. He's 39 years old. And are you aware of any allergy that he has, doctor?
no allergies.
Okay, that's perfect. And you're looking to know, oh, okay, how to adjust his insulin while traveling, right? Is that correct?
Correct.
Okay. And if anything else could help him, I mean, generally to control his condition, right?
Yeah, correct.
Okay. And you told me, Dr. Jamison, that he's not controlled. So, in what term? I mean, what's his current blood sugar or blood glucose?
Uh, as per last blood work, it was 8.2. His target
8.2,
is below 7. Yeah,
that's the
below
A1C or his I mean the blood glucose.
A1C.
That's A1C. Okay.
Yeah.
8.2. Okay. And okay, he's not controlled, and that's why you increase it, but you at the same time you want to know what to do for while traveling, right?
Yes.
Okay. And
And if any recommendation to improve his therapeutic plan.
sure, doctor. So if you don't mind, can I check my reference and get back to you, doctor?
Take your time. Thank you.
Okay, sure. Thank you. هي مش case 1 isn't it case 1 الريفرنس
Yes. Station
Yes.
1.
مش لاقي أي حاجة patient woman type 2 vomiting diarrhea risk of hypoglycemia pulse how confident your ability to roll medium high. So and what's his target, doctor? It's below 7.
Yes.
Okay. Patients prospection. Lower
2 minutes.
مش لاقي اصلا مش لاقي حاجه خالص بوكسس how important it is انا عايز تهت خالص
طبعا يا باشا.
ما طبعتها اللي هي الكويك ريفرنس جايد clinical practice guidelines of diabetes Canada, right?
Right, and you have another one.
Oh gosh.
I told you you have 2 references.
So this is the one that I printed. حول الله. Oh, Okay, so traveling east. So basically, doctor, based on my reference, which is insulin adjustments through time zones. Okay, so the patient is traveling east. So when traveling east, basically we lose hours and the day becomes shorter. Patient will usually need less intermediate or long-acting insulin and less sleep on the travel day. So basically that's, I'm sorry?
Okay, good. Sounds good.
Yeah, so the time zone, we could use the time zone. He's going back to Egypt, which is in zone 14. And basically he's traveling out of, okay, I'm in Alberta. So basically he's in Alberta, the same, like me. And that's zone 3, calculating. So do you want me to adjust to give you the calculated insulin adjustment based on that?
Yeah, if possible, yes.
اوكي، ما هو فيش
Should we
وقت.
adjust it?
be prepared, expect the unexpected. بقى هبقول له بقى الحاجات ديت في انا كمان عارفها تاني. No time. So basically be prepared, expect the unexpected. I'm gonna tell that to give him better control, to take supplies, know where to seek medical help, carry a letter on them from their physician and so on. Okay. And then I'm gonna calculate that total
Time
prevalence.
off.
Yeah, I'm sorry, that's I printed out different reference.
No problem. No problem يا دكتور. مية مية. Okay, sounds good. Thank you so much. How would you solve this station? What would be your recommendation here? Yeah, go ahead.
My recommendation, I know the answer that we're gonna reduce the dose, but I don't know the exact reduction. So I need just to know the reference and to read it.
Okay,
What's
no problem. So I would consider that you did it good.
Yeah. So
Okay,
basically,
so it would
and
be
then, but
30%.
after that, I'm gonna go back to check the things that I might need it, like checking the OTC, checking if other medical conditions that I should be aware of, about the vaccines and so on. So that's basically what I'm gonna do.
Exactly.
And so that's it.
Exactly. I asked you a straightforward question as well about the therapeutic plan. If you have any suggestions, any proposal to make his therapeutic plan better. What do
Yeah,
you think?
so basically yeah, I believe, okay, if I check the profile that this patient and he has type 1, basically he needs also to add statin to his profile, to his medications. So that's
Why you assume that?
I assume because he's type 1, but
Should we add statin with all type 1
I needed
patients?
I needed to ask how long he has been having this type 1, because if
Exactly.
it's more than 15 or 20 years, I can't recall exactly, then we need to give him statin to add it on the top of this.
Yes, we have a very relevant question here from iPhone. He asked about that.
Yeah.
Okay, he asked, yeah, he from iPhone. I can see his question here. Yeah, since how long has he been a diabetic patient?
Yeah,
This is very
that's-
relevant and very important question.
Yes, that's
Okay.
important.
He's not taken any statin. This is type 1 patient. He has more than one cardiovascular disease, cardiovascular problem. He's hypertensive as well. So this question is very important. Statin proposal is very necessary here.
Yeah.
Okay, so
Correct.
this is the first thing to do. Second would be about, what do you think about the hypertension treatment as well? He's taking
Yeah, I
amlodipine.
needed. Okay, so I need to ask about his blood pressure as well, if it's
Yes,
controlled or
correct.
not.
No, he's
Yeah.
not controlled.
Okay, so yeah.
Okay. Thank
Okay,
you for asking.
that's another
Thanks
trick.
for
Yeah,
asking. Thanks for asking, but he's not controlled.
yeah,
Okay, blood pressure is not good. So exactly, we have here ST, he's proposing ACE inhibitors. Correct, 100%. So ACE inhibitor would be a good proposal as well.
so
Okay.
yeah, just
We
asking
have
about
diabetes,
other
we have
conditions.
diabetes, we have blood pressure. The main concern here about those adjustment, you would have answered it about in 10 seconds. Okay, as Banan did. You know, Banan answered it very quickly. You
Yeah,
have to reduce the dose of the basal insulin by 30%. That's it. You kill the objective. You kill
I kept checking the reference 100 times because I thought this is the answer where I should find it, but I couldn't find anything. So.
Okay, no problem, no problem. That's why we are here. We are here to practice, to find out the
Absolutely.
errors. Yeah, okay. So yeah, so no problem at all. So this is like the therapeutic problem here, guys. The blood pressure is not controlled, so you can add ACE inhibitor or you can switch him to ACE inhibitor. This would be better. Statin as well is very necessary because the patient is 39 years old. He's diabetic for more than 20 years. And he has more than 2 cardiovascular diseases, problems. So statin is necessary as well. Aspirin, you can leave it. It's not a big deal. This is for as well for primary prevention. Aspirin is not no like significant evidence how to use it in primary prevention, but no problem. You can leave it as it is. Insulin sounds good. We have to keep adjust the dose as per his travel. What about vaccination? This guy is
Yeah.
immunocompromised. He's traveling to the beautiful Egypt, where there's like so many microbes and etc. So vaccination is very important as well.
Yeah.
Yeah.
Okay. So
That's important. Yeah.
what do you think, guys? Yeah, we have Mina is asking why ACE inhibitor? Why should we propose ACE inhibitor here, guys?
Yeah, ACE inhibitor is important for cardiovascular protection. On the top of, he's diabetic hypertensive. So the first thing that we should think of the ACE inhibitor or
What else?
To
Yeah,
protect kidney.
kidney protection, exactly. Yes.
Yeah.
Yeah.
Kidney and cardiovascular protection. Yeah, that's why ACE inhibitors are preferred.
Yeah.
Okay,
Can I ask a question,
sounds good.
Doctor?
اتفضل يا باشا، اتفضل يا دكتور.
Yes, you ask Banan if we will decrease less pro insulin or no. So what is the answer? I will decrease the
check?
basal only.
Did you check? Yeah. You will
Okay.
only need to decrease. Yeah, you will
Yes,
only
I checked, but
decrease
I
the
just
basal.
need to confirm. Yeah.
Only the basal يا باشا.
Okay. شكرا.
Only the basal. Okay. For
Yeah.
Banan and for Mu'min as well. Okay, do you find it would be relevant to ask about the weight? What do you think?
Asking about his weight.
Yeah.
Yeah, it would be good to ask about the weight and the exercise, just in terms of talking about the pharmacological, non-pharmacological things to help the patients control his weight. Speaking of he being diabetic and hypertensive as well.
Okay. Banan, what do you think?
Yeah, to ask about his diet, because normally the type 1 diabetes, they are overweight. So maybe that we have to refer him for dietitians.
Okay. Weight is important as well, guys. It could be one of the reasons why this patient is not diabetically controlled. Okay. So weight could be irrelevant here. Can we propose something like Ozempic for him?
Here in Canada, I don't think that Ozempic is approved for weight loss yet. So, and especially that Ozempic is type 2. Basically, it's type 2. It's type 2 medication, not type 1. He's taking insulin.
But we can take with basal.
What do you think?
We can take with basal?
What do you mean we take with basal?
I think we can give only for with the GTF.
Guys, okay, so I'm gonna mute the Shadi. You have to mute you, Shadi. Okay. Here we go. Yeah, go ahead.
For Ozempic, we can give it with basal.
What do you mean with basal?
Just with basal, not with regular insulin.
Oh, it's not given at all for that one.
مش فاهم السؤال، أنا مش فاهمك معلش، يعني قصدك إيه؟
حضرتك بتسأله ينفع ندي أوزمبيك ولا لأ؟
Yes, what do you think? If the patient is overweight, can we suggest adding Ozempic here to help the patient lose weight and better control his diabetes? What do you think? I'm asking, I'm just brainstorming with you.
It's not for
Because
that
he
specifically,
is
and it's
type
type
1, I
1.
think. Yeah,
What?
no. Type 1. He is type 1.
Yes, okay. Can we use it or not?
It is not.
Well,
It's
I
not.
need one word. Can we use
No.
Ozempic for type 1 or no?
No.
No. Okay. It will be approved soon, guys. It will be approved
This
very
is,
soon
yeah,
for type
by the way, we had this discussion yesterday with group of pharmacists, and it's not yet approved. So that's why I said it's no.
Yes, it's not totally approved, but it will be. It
Yeah.
will be very soon. Anyhow, okay. Yes, do not use Ozempic for now. Okay? Ozempic we couldn't recommend it for type 1 for now. So here we go. This is the station. Vaccination is very important, as I mentioned, follow-up and okay. So for me, from our perspective, we concluded that we should recommend statins, and it would be better to have a better grip on the blood pressure to control it better. None of you, unfortunately, asked about the blood pressure. Is it controlled or not? This is a medical condition, and you have it here in file, so you have to ask for it. Okay. You have a family doctor, so it's healthcare professional. Important as well to ask about if any problem in liver or any problem in kidney. You can ask these questions as well. Okay, any kidney problem, any liver problem, that's it. It's very important to pose this type of questions for a healthcare professional, especially if some medications may need some adjustment. Okay, you got me? So if you're gonna propose a statin, you have to make sure the liver is good. Correct? For statins. If you're gonna propose ACE inhibitor, make sure that the kidney is good as well. بس كده صباح الفل. يلا station number 2. Hala is asking, do we need to modify insulin dose? Yes, as Banan mentioned and answered, according to the reference that we have, we will need to decrease the dose by 30%. 30%. Okay?
which insulin يا دكتور اللي هو البيسل ديتيمر right?
Basal. Yes.
Okay.
What? Please excuse me. What do we do about the diabetes that is not well controlled?
Diabetes what?
I thought the doctor said the patient's diabetes wasn't well controlled.
Yes, it's not well controlled.
Are we going to
As per the last A1C.
okay, so are we going to increase the list produce?
So the physician, the doctor said that he has recently increased his insulin dose, right?
Okay.
So
okay.
as per the last A1C, A1C we do it every 3 months, correct?
Yes. Yes.
The last one, we don't know when was the last one. Could be like 1 week ago or
Okay.
something. Okay, and this should be the case, by the way. The
Okay.
A1C recently was not good, so the doctor decided to increase his insulin dose by 2 units from each. 2 units before the meals, 2 units on bedtime. Okay?
Okay.
When the guy is traveling east, he's traveling east to Canada, to Egypt from Canada. So according to the reference, you will have to adjust the dose to reduce it by 10%. But as well, one important point, and the colleagues forgot to mention it. This guy will be back to Canada in 2 weeks. Okay? What should he do?
He should
You have
increase.
to mention that as well. Okay? When he back to Canada, he has to do that and that. Okay?
بس هو simple clarification دكتور احنا بنحكي بس على الدي اوف ترافل رايت؟ لما يروح على مصر ولما يرجع على مصر in the day only in that days only مش the whole travel period.
لا ليه ترابل؟ ليه هو ترابل بيريد؟ only day of travel.
يا اوكي بس بحاول افهم الريفرنس معلش.
لا هو بس الوقت القصير بتاعه، اليوم هيرجع بعد كده يبقى اليوم عنده. هو
اوكي
طبيعي اليوم 24 ساعة، ما هو مصر اليوم فيها برضه 24 ساعة، مش متاكل منه وقت يعني. you know. طيب يلا بينا ستيشن 2. نظام.
Yeah, okay.
يلا ستيشن 2
Let's
يا
go.
نظام يا جميل.
Okay.
Okay.
So,
Reference guys.
who will be the pharmacist?
I'm gonna send you the reference for station 2. There you go. Here you go. I send you station number 2 reference to the WhatsApp group, to the Telegram group. Here we go, guys. Let's start.
Okay. Who's gonna do it with me, guys?
We had
be-
2 volunteers. عبيد وكان أحمد، بس عبيد اللي رافع إيده. يا
Okay.
محمد يا عبيد.
يا باشا.
صباح العسل.
يلا يا دكتور. Let's go.
استنى اخد لك الوقت انا نظام 7 دقايق.
ماشي يا دكتور.
عبيد you have 30 minutes 30 seconds to check on the reference, okay?
Okay.
Okay, start.
Hi, I'm here to pick up my medication, please.
Sure. This is Mo, the pharmacist, and I would be happy to help you. Would you mind to have a seat in our private counseling area? Anything
Yeah, sure.
going to
Thank you.
discuss? I'm gonna be confident. Can I
Okay,
start with
thank you.
your name and age?
My name is Hassan Shakush, and my age is 57 years old.
Okay, Hassan. So what made you see the doctor today?
Yeah, I actually broke my arm. Like yesterday, I went to the emergency room and they gave me this medication in the emergency room, and then the doctor prescribed me this medication to continue using it for brief throat pain.
Oh, sorry to hear about that. Yeah, it must have been stressful for you night in the emergency. But rest assured, I'm gonna
Yeah.
do my best to help you with that. Sure. So
Okay,
yeah,
thank you.
would it be okay to ask you a few questions just to check the appropriateness of the prescription?
Yeah, sure, go ahead.
Okay. Can you rate your pain according to the pain scale? 0 is no pain, 10 is the maximum pain you ever encountered?
You can say like it's moderate to severe pain.
Moderate severe. Okay. Yeah, and so you mentioned like what made you sorry, what's the cause of the pain again?
Yeah, I broke my arm yesterday. Yeah.
Oh, perfect. Okay. Any allergies do you have then?
Yeah, I have codeine allergy.
Codeine allergy. Okay. And how was it? Like in hives and shortness of breath, or just a
Yeah,
rash?
it was like no, it was just like hives.
Was it all over your body or just like a?
Yes, all over my body. Yeah.
Oh, okay, perfect. So I check here your file. You're taking methadone 10 milligram per ml. Yeah, last time you got it like yesterday. Yeah.
Yes. Yeah.
And why are you taking the methadone is for?
Yeah, I use this one like regularly. It's
Is it
as maintenance. It's maintenance therapy because I was, addicted on opioids. So I use this one like as
Oh, okay.
maintenance therapy, to help me get off opioids. Yeah.
Okay. And on the file here, there's hydromorphone 2 milligram. You're not taking this anymore?
No.
Okay. Any over-the-counter medication you're taking?
No, no, I'm not taking any over-the-counter medication.
Any medical condition that you have that is related?
No.
Okay, perfect. Yeah. Okay, about your lifestyle, do you smoke by any chance?
No, I'm not.
Okay. You have time to do some exercise then?
I barely go out.
Okay, perfect. Yeah.
I can check the food.
I'll check my reference and get back to you then.
Okay, thank you.
Thank you.
Guys, I'm gonna mute everyone, okay?
Okay.
We have some noise, I don't know from where.
So did you talk with the doctor about the methadone that you're taking already?
Yes, he's aware.
Okay, what he told you about this new medication then?
Nothing. He told me that he will explain everything.
Me, myself, is the pharmacist. Okay, give me 1 second. Yeah, I just have one concern. I'll just double checking my reference here about taking the methadone along with the morphine sulfate, the 20 milligram, which is Cadian, sorry.
Okay.
Okay. Yeah, I'm checking and get back to you. Give me 1 second.
Okay, take your time. Thank you.
2 minutes remaining.
Okay. Perfect. So, okay. So I checked my reference here. I just do want to have one concern about the dose of the Cadian. Like your, well, if Cadian combined with other opioid or it might be causing like respiratory depression, which means like shallow breathing. And this is like a serious side effects, I would say, or combining the two medication together.
Okay.
Yeah, so I would really like need to get back to the doctor first to confirm the dose with him. There is also other alternative for you. Yeah, like I mean, you can still use the methadone itself as a pain.
Can I take ibuprofen for 100 milligram to control my pain?
400 milligram.
Besides Cadian.
Is there a reason? Like Cadian is a powerful and painkiller. I wouldn't say that you need the Advil for it. Is there a reason why you'd like to use the Advil?
No, I'm just asking you because I have like a severe pain.
Okay, okay. So yeah, so the Cadian, as I mentioned, it's a powerful and painkiller. So hopefully it's gonna cover your pain for this duration until like you see your doctor again. Do you have any soon appointment with the doctor?
No.
Okay, so he just gave you the painkiller, the Cadian, and that's it. Like you don't have a follow-up for your broken arm?
Yeah, I have like a follow-up after I don't know 2 weeks or 1 month, something like this, but not recent.
Okay, so sounds good. So I'll just fax the doctor and I will give him some recommendation alternative for the managing your pain. The methadone dose can be
Time is
okay.
up, but I can let you know.
Methadone could be divided on 2 doses per day, so it's gonna help to cover your pain along with the cravings for the detoxification program. Yeah, that would be my recommendation.
This is what? Sorry, I bet.
Methadone dose would be divided two times daily instead of once daily.
Okay. Okay, so you know he will have to come. Okay, he will have to show up in the pharmacy twice daily. Correct? There's no carries. No carries here. Okay. Anyways, okay. So yeah.
Okay.
Nizam, if you have any comments, please go ahead first.
I'm sorry, doctor, I can't hear you.
If you have any comment for Abate,
Yeah, I think we
one more.
Give me that phone.
Guys, please.
I think let's take someone else, and then we will give Dr. Abid like the comment over his performance. What do you think?
I think we can. He almost did it. You know, he almost did it.
Yeah.
But I have some comments to him. But you can go ahead first if you have any. Yeah.
So yeah. First, you did really good regarding like asking some relative informations, which the assessment you asked about what is this for. You welcomed me. You asked about my information, and then you asked about why I'm using this medication and what happened. Okay, and then you read the profile. That was very good. Why are you using this medication? Did you stop using the other one? That was really nice one from you. And then you asked me about my if I take like any over-the-counter medication, if I have any allergy, okay, codeine, okay, what happened, and any over-the-counter, any herbals, and that was really thorough and effective. Then you asked me about my lifestyle. You just asked me if I smoke or
Yes.
if I do exercise,
Exactly.
but you didn't ask me like if I consume any alcohol, which is relevant and essential question here in this case, because there is like a clear drug interaction between Cadian or morphine sulfate 20 milligram and alcohol, and it's one of the things that you have to keep your eye on. This
Okay.
medication shouldn't be used with alcohol, and the patient is actually drinking like 2 cups of alcohol. So you missed the question, so you missed the point, you know?
Yeah.
That's why assessment is very important. You need to ask all the relevant questions here. Okay. Here, alcohol is much more
By the way,
important
the
than
patient is
exercise.
heavy alcohol. Yeah, heavy alcohol drink. You know, he drink about 2 cups and
Yeah,
every night.
like
This was the case.
2 cups per day. You're right. Yeah. Okay. So then after you finish, you took like 2 minutes and you checked your reference. That's really good. You will take a point for this in the exam for checking reference. So in the reference, I would just like to ask you, where can you find like this information that you shouldn't use the Cadian with methadone? He's using methadone, by the way, as you know, as an opioid maintenance therapy,
Yeah.
not as a painkiller. Okay, and he's just using this new medication, the morphine, to help him control the recent pain, the acute pain. Okay,
Yeah.
so I just want to ask you, where did you find this interaction or this contraindication of using morphine sulfate along with the methadone hydrochloride?
It's in the serious warning and precaution, the risk of concomitant use of benzodiazepines or other CNS depressant.
Okay.
So,
Okay.
Mhm.
So do you think like is this like a warning or a contraindication?
Okay, a warning, I would say.
You asked me, is your doctor aware that you're using this medication along with methadone? And I told you, yes, he's aware that I'm using methadone. And he asked me to use this one for pain. And I told you that I took the first dose like yesterday in the emergency.
Oh, I didn't hear this part.
Yeah, in the early beginning of the case, told me, okay, what happened? I told you I visited the emergency room. They gave me this medication to control the pain, and the doctor asked me to continue using it starting the following day.
Okay.
So I took this medication already, like yesterday, and there's like 2 points here you have to cover. Oh, you took this medication yesterday and nothing happened. You haven't developed any rash. Okay, that's good because you have a codeine allergy on your file and there is a cross allergy between this medication and codeine. But that's relieved that you took this medication yesterday and nothing happened or no allergy like occur on your body, and that's good. Okay, you can just like warning the patient there's like a drug interaction using this medication along with methadone can put you at risk of blah 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 blah. So you have to keep your eyes on any symptoms of shallow breathing or symptoms of respiratory depression. You can warn the patient, but there is no absolute contraindication here of using this medication along with the methadone. Okay, so it's very important like to get the answer from the reference.
Correct. This is
Yeah.
not, you have an urgency condition here. The guy is in
Yes.
severe pain. He's coming from a hospital, so you cannot, simply speaking, you cannot advise him to wait to see his doctor again. You know, you understand? But
Yeah.
what you have, your concern is like valid. You have a good
Yeah, it
concern,
is.
by the way. So you have a combination of two potent opioid. Yes, the risk of respiratory depression is
It's
you
high.
cannot neglect it. Okay,
Yeah.
but from your side, what corrective action, what corrective measure you would have taken here? What do you think?
You can call the doctor's office myself.
No,
the-
forget about that.
Mhm.
No contraindications. So why for what reason you're gonna call the doctor? By the way, dividing the dose in two parts, you will make the patient suffer. You got me? So he will come to the pharmacy. He will have to come to the pharmacy twice daily, one in the morning, one in the evening, to divide the dose and etc. Okay,
Okay,
you can
and
do
there
that.
is one more point here, Dr. Mohammed. I'm sorry to interrupt you.
Yeah, methadone is
We
long
did-
acting one.
You're right. Methadone is long acting. You didn't have any supporting reference or document in your hand right now to tell you this, to tell you to do this or to go with this strategy, like dividing the methadone dose and like 12-hour dose. So
Right.
don't get or don't say any information
Don't
which is
assume,
not
yeah.
included in the reference because it will be like a misinformation and you will be punished for this in the exam. Just stick to
What do
the
you think,
reference.
guys? If we have, yes, what do Nizam? Let's ask the guys here. What do you think
Okay.
if we can? We have a concern here from Mohamed Abeid about giving two potent opioids at the same time, and the concern, it's not a contraindication, but yes, there is a risk. What do you think? What could we do here?
دكتور محمد اتوقع الدكتور محمد عبيد كان قرأ اول الورنينج limitation of use. This patient we didn't use non-steroidal alternative treatment with them. فاتوقع هذا is a concern انه to use non-steroidal first, maybe to fax the doctor to use non-steroidal to control the pain instead of giving Cadian.
He asked the question, guys, on the pain scale. How bad is your pain? What was your answer, Nizam? You give what?
Yeah, I
What
told
was it?
him it's from moderate to severe.
So we don't give non-steroidal for moderate to severe.
Okay, so yes, here you go. So
In addition, I have a question actually.
yes, go ahead.
So if the patient has been prescribed opioids or whatever from the doctor, should I ask about the pain, the scale, the pain on a scale? I mean,
Yeah,
that's
why not?
being prescribed.
Why not?
It
Yes,
is because
For me, I wouldn't do
asking
it.
about pain. Okay, asking about the pain and the pain scales means that I'm gonna go through assessing the doctor diagnosis.
Yeah.
No, my friend.
Well,
Yeah.
Dr. Mohammed, I agree with him because it will be like a waste of time asking about the pain scale because he has been already assessed in the hospital, in the emergency room. And according to the assessment, they found that this would be like the best option for him. So he has already
I would
been
like to
diagnosed.
understand. Yeah. This.
Yeah.
I'm agree with you as well, but asking on the pain scale, it's not. It could be the only reason here is to ignore it. It could be like a as you say, the waste of time, but there's nothing
Yeah.
against, nothing
No,
against
not at
to ask
all.
about
No, not at all.
it. You can
Just
ask to
like it,
understand how severe it is and to make documentation as well for you. You may be thinking on another alternatives, you know, if the pain scale is about 4 or 5 out of 10. So why not to try first to keep the prescription aside till we verify that with the physician and give him a high dose of ibuprofen instead, like 400 milligrams or something. You got me? So yeah, so there's another approach as well. You can
That's
think
fine.
about other approach. Okay, so nothing to do against. Your way of thinking is good, not a problem. But to make sure that you have the good information, relevant information as well is important to make a decision. Okay.
Okay.
So yeah,
Can I say
this
I have a
opinion.
question, Doctor.
Yeah, go ahead.
Yes, in reference, it mentioned that this product is contraindicated in acute pain, management of acute pain. So Dr. Nezam said he has a breakthrough pain. Is it valid to give this medication? And he has allergy from codeine. In reference, also mentioned contraindicated if you have a allergy from other opioids. So what we
Yes,
would choose?
very good question. Very good question. You can see that this. Can you check the prescription? Open capsule and sprinkle it on the methadone dose and etc. So what benefit it could bring here if we're gonna open the capsule and spring it on etc. Okay. في ناس بتتكلم كتير. Okay, so
One capsule, okay.
yeah, open the capsule, sprinkle it on the methadone dose. If you're gonna open the capsule, you will have like a you will have a rapid action onset of action of the Cadian.
Okay.
Yeah. Moreover, we have
we can dispense a pill and just give him naloxone cat along with, and educate him about the signs of overdose, and that's it.
Yes يا باشا انت فين من
Yes,
زمان؟
exactly.
انت فين من
Yes,
زمان؟
that's it.
انت
Yeah.
فين من زمان؟ We're waiting for this answer since 10 minutes. Yes, exactly. Yeah.
Okay. I know, like
That's it.
even the methadone is still able to get like a opioid, but it's still like it's the doctor decision. I know methadone is nothing, like as if it's not there. Methadone just to prevent the cravings and the withdrawal
Right.
symptoms. But
Yeah, it's
still
just
like
for
a
opioid.
Yeah.
Yeah, it's an opioid maintenance therapy. It's not here for pain, and the patient is in severe pain, so he has to use this medication. I know a lot of patients actually in the daily practice who are on methadone and other opioids as well in the pharmacy, in the actual field. So regarding your question, doctor, about his allergy, the patient already took hydromorphine before, according to his file, and nothing happened. And also he took the first dose of this new medication, the morphine sulfate, like yesterday in the emergency room, and nothing happened. So you don't have to worry about the allergy here. Okay.
Thank you,
You can just like keep your eye on if you develop any rash all over your body while using this medication. You might have an allergic reaction against it, so stop using it. It's just like there's no contraindication here. They are all like warning. You have to warn the patient from the signs and symptoms of opioid overdose and how to deal with it. Warning the patients of allergic symptoms and how to deal with it. But there is no absolute contraindication here to prevent you from using this medication along with methadone or in case of codeine allergy. Then you have to go and to do like a full counseling on the medication, how to use the medication, what is this medication for, onset of action of the medication, then the side effects of the medication and how to deal with it. Like if you develop constipation, for example, you can increase water intake, fiber intake. You can take like over-the-counter laxatives. This is very important as well to tell the patients the side effects and how to deal with the side effects as well. Like 1 or 2 common side effects, and then the allergy, and then monitoring with the patient. Monitoring here will be regarding the pain. Okay, if you feel like the medication is not controlling your pain, you can discuss this with your doctor. He may increase the dose for you or not. Okay, if you develop like any unusual symptoms of opioid overdose, like
Overdose,
1, 2, 3, okay, you can start using this naloxone kit immediately, and I will print out a form for you to tell you exactly how to use the naloxone kit. So this is monitoring and safety as well.
Yes,
Okay,
clearly.
and that's it. Okay, and can I give you a call like after 2 days to check on you and how do you do with this medication, and if there's any side effects, we can discuss it together. So this is like a follow-up plan.
Okay, thanks. Yeah, clear.
Okay, yeah, just like simple like this. Okay, as simple as this. Do not complicate the case for yourself. Just try to read the reference very carefully, and don't come out with any information which is not in the reference, which is not clearly said in the reference, even if you know this information from any other place, because it will be considered as misinformation.
Okay.
Correct. Totally agree.
Yeah,
Good job.
that's it.
Okay,
Yeah,
guys.
I have a quick question, please.
Yeah, go ahead.
Yeah.
So where's the best place to check?
Sorry, I think I muted you. I muted you by error, Shelly.
Oh, yes, I said, where's the best place to confirm the answer to this question? Is it in the drug interaction? What?
Yeah.
Sorry. Didn't get
Okay,
you.
all right.
There's a lot of noise in the background. Well, it's the best way for me if you have like a multiple indications in patient's profile. Okay,
Yeah.
so the best strategy to solve a case like this, okay, is to read the contraindication first for any medication, for any new medication, and then go directly and check the interaction as well. If the patient is on like 1 or 2 or 3 medications, you have to check the drug interaction between the new medication and the medications the patient is on, and also the contraindications of the new medication. If you feel like everything is good, so you just go directly and check the side effect of the medication, the onset of action, the indications, and start counseling the patient on all of this. But the first step you have to do is to make sure it's the safe medication, and it's the appropriate medication the patient can use safely with his other medications and with his condition as well. So this is how you should like treat or deal with any new medication, and how to deal with the reference as well. And you need to be aware of the reference, where you can find the information. Reference always like is organized in a specific way, like indication first, then warning, then contraindications, then onsets, then side effects, then some serious side effects, then some special populations or dose and adjustment, stuff like this. You have to be like to familiarize yourself how is the reference organized, so it will be easier for you in the exam to go directly and locate the information. Yeah.
Okay. Yes. Okay, guys. So I think we had enough with this station. So I hope it's clear now. Yeah. So the right action would be you can dispense the Cadian, no problem in that. But you have to teach the patient about how to use the Narcan and to recognize the overdose symptom of combining two opioid together. Moreover, the recommendation would be not take the Cadian at the same time with methadone. It would be better if the patient can separate them. Take one, like if he's taking methadone at the morning, so it would be better if he could take Cadian at bedtime or at supper time, for example. Okay. Second would be the alcohol consumption. The patient is taking alcohol, like 2 or 3 cups per day. So it's important as well, either to reduce his alcohol consumption or to suspend or to not taking any alcohol with during the treatment with Kadian. Okay, sounds
Okay.
good. طيب يلا بينا ستيشن 3. مين هيدخل ستيشن 3؟ Who's the volunteer for station number 3? Raise your hand. مؤمن والي. ماشي يا دكتور مؤمن. شوف لو حد تاني غيرك بس ندي أولوية لحد تاني.
أكيد.
So any other colleagues؟ عبد الهادي الشرقاوي.
Oh, my friend.
منوفي شكله كده. انت شكلك منوفي يا دكتور عبد الهادي.
من قوي يا دكتور يبقى منوفي ازاي؟ لسه الشتاوي
انت شراوي فعلا؟
لا من محل.
حلة. طيب غرباوي. شفت بقى؟ انت غرباوي فعلا. Okay. Okay, guys, we have station number 3 here. It will be with you, Nezam, as well, no?
Okay, I'll give him like 30 seconds to check the door note
Okay,
and the reference.
we have to send the reference.
Yeah, I'm asking about reference.
Yeah, I will send it now to the WhatsApp, to the Telegram group. Sounds good. Nizam, you will do this station, correct?
This one? Oh, okay.
ثانية أنا ما بعتهاش على الواتساب. One moment, guys.
هو دخل على الجروب الاول وقال لو حد عايز نخش ساعتين كده
Okay.
نتدرب مش مشكله. راح السيد قال له طب ما تعمل لنا جدول نظام كده انت جاي في جروبي وتاخد السبورت.
اوكي شباب هنعمل
اعمل لنا جدول كده على 8 ايام.
محمد يا محمد عملت لك ميوت يا محمد.
Okay, so it will be
you have
me
now
and
station number
Mohamed.
3. Yeah, station number
okay.
3.
Okay.
Okay, so Abdelhadi, I'm gonna give you 30 seconds.
Okay, thanks.
Yeah, here you go.
Hi, I'm Ahmed. I'm a pharmacist in duty today. How can I help you?
Take your time. Your time. You have 30 seconds.
Okay. Go ahead. Go ahead.
I have meeting.
Okay. Reset. Dr. March.
Okay, no problem. Go ahead. Start.
Okay, let's go.
Hi, I'm Ahmed. I'm a pharmacist in duty today. How can I help you?
Yeah, I have a concern, please. I have like some muscle pain started like a few days ago, and I'm looking for something over the counter to deal with the pain. So what do you recommend?
Sure, I will do my best to help you. Sorry to hear about your pain. I will try to figure out what's the reason behind that. So, would you like to have a seat in our private counseling area so everything you are discussing will be confidential?
Yeah, sure.
Okay. May I ask you what's your name?
Yeah, my name is Gafar Al-Umda. Dr. Mohamed Ali Kasman. Yeah, my name is Gafar Al-Umda.
Okay. So you have a concern about muscle pain, right?
Yes.
Yeah. Okay. Okay, Gafar. So I have some question to make sure I will do the best recommendation for you. Okay.
Yeah, sure.
Okay. May I ask you to explain what symptoms, if you have more explanation, since how long this symptoms has been started?
Sorry, say it again.
Since how long? Yeah. Since how
Yeah,
long you have these symptoms?
it's like few days ago.
Yeah. Okay. So I would like to check your profile just to make sure it's up to date. Okay.
Yeah, sure. Okay.
Okay. I see here that you are 67 years old, right?
Yeah.
You have allergy to sulfur. Is correct?
Yes, you're right.
Yeah. Any other kind of allergy that you have? We may update
No.
your profile.
No.
Okay. I see you are taking Synthroid 50 microgram. Is it correct?
Yes.
How you are taking this medication?
I take like 1 tablet every day in the morning before
Okay.
breakfast.
Okay. Do you have any side effect with this medication? I mean, like changing your energy level or something like that?
Well, I don't know, but I feel like these days I'm not feeling very well. I'm somehow like fatigue and I can't tolerate cold. I don't know why. Yeah, I think like it's related also to my muscle pain. So I think any over-the-counter medication will help with this problem. That's why I'm here.
Okay, Gafar. So yeah, we will figure out that. So I may go through to continue about your profile. I see you are taking atorvastatin 80 milligram tablet.
Yeah.
Okay, so why you are taking this medication?
For high lipids. Actually, I was on Lipitor, but I couldn't find Lipitor here in the pharmacy. And the technician told me that Lipitor is back order and is not available. And this atorvastatin it's the same medication. I don't know. Maybe it's the reason why I have pain because I'm on the wrong medication.
So you are taking atorvastatin 80 milligram, right? That doctor prescribed to you.
Yes, but I was on Lipitor and Lipitor is not available. So you guys give
Yeah, it's the
me
same.
atorvastatin.
Yeah, it's the same. Yeah, Lipitor is the brand name and atorvastatin is the generic name. Okay,
Okay.
okay. So I see you are taking amlodipine 5 milligram, right? You are
Yes.
taking 1 tablet once daily.
Yes.
Okay, and how about your blood pressure? Is it controlled?
Yes, it is.
Okay, any other medication that I have to know?
No.
Okay, what about any other over-the-counter medication that you have that I should know?
No.
Any herbal products? Any herbal products you are taking?
No. But I was
Okay.
actually thinking to take ginseng for fatigue. So I don't know what do you think?
Ginseng. Okay, who recommended that for you?
No, and I'm just asking you. I read about ginseng for fatigue, and as I mentioned, I have some fatigue, and I can't tolerate cold at the moment, and I have some tremors as well.
Okay, 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 Gafar. So, may I ask you for a few seconds to check my reference and get back to you?
Yeah, sure. Sorry, not tremors.
Okay,
I'm sorry. Okay. Yeah.
okay. Just need to confirm with you for how long now you are taking Lipitor?
Yeah, it's been like 3 months now.
3 months. Okay, okay.
2 minutes remaining.
And you told me that you are taking ginseng or you are thinking
No,
to
no,
take this one?
I'm not taking ginseng.
Yeah.
No, I'm not taking any herbal
Okay.
medication. Yeah.
Okay. Okay, thank you for waiting. According to my reference, I see that you have some changes or instability in your thyroid hormone. It's a hormone that control your level of energy, and I see that you may have like myopathy. Myopathy is like muscle pain that you have now. That you may have if your thyroid level is not within normal level. So I would say that, give me one moment, please.
Okay.
Just a second, Gaffer, please.
Yeah, sure. Take your time. Thank you.
Are you taking any grapefruit juice or something like that?
No, I'm not.
Okay. Okay. Are you a smoker?
Okay, time is over, guys.
No.
Yeah.
Time is over, yeah, Abdul Hadi.
Yeah, I didn't figure out because
You spent what I would like to say here. You took 5 minutes to complete your assessment.
Yeah.
Only your
yeah,
assessment. It took you
Mhm.
5 minutes to do the assessment. So long. It's so long. You cannot
trying to
do.
know what's the interaction here. I can't see like interaction.
There's no
Um,
interaction. What type of interaction, my friend? It's amlodipine, Lipitor, and Centroid. That's it. It's
he
finished.
has muscle
Really,
pain,
like,
so
okay, you have
look,
yeah,
it's like
figure it
high
out.
dose
Figure it
or
out.
something like that.
Okay, we're gonna find out. So I would recommend that
Okay.
we retake this station with another volunteer.
Okay.
Can I do it?
صح يا نظام?
Okay.
Yes.
Yep. Let's go. Okay.
We have Samawi here.
Can I do it, Doctor?
Hiba. Yes. Who's first, guys? We have Samawi, Samuel. We have Samuel and we have Hiba. Who's first? Because I saw Samawi raised his hand as well.
Okay, no problem.
Samawi is a girl or a guy? A lady or a guy? If you are a guy, so we're gonna start with ladies first. So it's gonna be Hiba. If you are a lady, so we will have like a conflict here. Samuel, Samuel, unmute your mic, please. Okay, so I assume he's a guy.
Okay.
Let's start with Hiba.
Okay.
برضو
Let's go.
كمان
Let's go,
تريان
Heba.
لازم تاخد فرصتها الأول. اوكي. one
معلش
moment.
هو
Okay.
الكيس دي ليفل الوحش ولا في ابعد من كده تاني؟
لا
level
ده مش وحش خالص.
ده فيهاش وحش خالص، ده ليفل سوبر ماريو.
ماشي
سوبر
تمام.
ماريو الأول خالص يعني. اللي جاية اللي بعدها ممكن تبقى هي ليفل
اللي
وحش.
بعدها وحشة شوية.
ايوه
Okay, let's go, Dr. Heba.
كله ضرب.
Yes. Let's go.
Okay.
Let's get started, guys. Here we go.
Guys.
Okay.
Yes. Start. We started, okay?
Okay.
Hi.
Hi, I'm Heba, the pharmacist. How can I help you?
Yes, I need your help, please. I have some muscle pain in my legs. Okay, and I would love you to recommend me something for this muscle pain.
Sure, I can help you with that. I'm so sorry for that. It seems bothering you. Do you mind to have a seat in our counseling area, and whatever we discuss, it will be confidential?
Sure, thank you.
Okay. First, I'd like to ask you a couple of questions to give you appropriate assessment. Is it okay for you?
Yeah, sure, go ahead.
Okay. Can I know full name and age, please?
Yes, my name is Gafar Al-Omda and my age is 67 years old.
Okay. So today, what is your concern, Gafar?
Yeah, as I mentioned, I have some muscle pain in my leg and I need something like over the counter. I don't know, anything you recommend to help me controlling the pain?
Okay. Since how long you have these symptoms?
Yeah, like a few days ago, started like a few days ago.
Okay, let me check your profile. I see here that you take Sensoryid. Is it for hypothyroidism, right?
You're right, yes.
Yes. And is it controlled?
I don't know. Actually, I haven't checked my
Didn't check.
thyroid level.
Sorry?
I haven't checked my thyroid level like since a while, so I have no idea if it's controlled or not.
Okay, and Lipitor for hyperlipidemia, right?
Yes, actually, I was in Lipitor, but you guys told me it's back order, so you switched me to atorvastatin. I don't know if it's the same or not.
Oh, yes, it is the same. Yes. Since how long you take it?
Yeah, I think like 3 months ago. I have started taking it like 3 months ago.
Okay, and your lipid profile is good. You make recently any blood work?
No.
You don't know. Okay, and the Norvasc, this is hypertension, right?
Yes.
Okay, did you measure your blood pressure or no?
Yeah, I think it's controlled. Yeah.
Okay, it sounds good. Thank you. And do you have any other medical condition not indicated in your profile?
No, I don't think so.
Do you take any other medication?
No, I'm not.
Okay, do you have any allergy?
Yes, I think according to my file, I have
Yes,
sulfur.
I see here. Yeah, I see here you have a sulfur allergy. Is
Yes.
it? Could you please explain for what type of allergy? Is it just a rash or?
I remember I went to the hospital because of this.
Okay.
I don't know what do you mean by what type, but I went to the hospital.
Okay. Okay.
I will break it on the file.
Okay, thank you for that. Or do you take any over-the-counter herbal or multivitamin?
No, I don't.
Okay, your vaccine is updated?
Yes.
Okay, do you mind to ask you a couple of questions about your lifestyle?
Yeah, go ahead.
Do you drink alcohol?
No, I don't.
Caffeine?
No,
Okay, are you smoking?
I'm not.
Okay, do you practice exercise?
Yeah, sometimes I walk like every day for 30 minutes.
Okay, and for your healthy diet, because it's very important with medication like Lipitor to follow a healthy diet. Do you follow? Yeah, that's
No,
good. It sounds good.
I eat on the go.
Sorry?
I eat fast food, a lot of fast food.
Eat fast food. Okay, let's explain later about this point. Okay. Thanks for all this information. I just need to check my reference and back to you. Okay.
Okay, thank you.
Thanks for your patience. According to my reference, as mentioned here, with your case, we need to check with doctor the level of TSH, okay? Because in some cases with hypothyroidism and take a statin, it may induce some muscle pain, and that's what you experience now, okay? So my recommendation is to see your doctor for more appropriate assessment. We need to make some blood work and check some.
2 minutes.
Sorry?
Okay, 2 minutes. Okay, you know what? I feel a little bit tired as well recently. I'm not concentrating and can't tolerate cold. So, do you recommend like any over-the-counter medication for this? Like, I don't know, ginseng maybe, as I heard.
Yes, it seems this is symptoms of hypothyroidism, okay? So
Okay.
it's better to see the doctor for more investigation. Maybe we need to stop statin for time till symptoms resolve it, and we back again with low dose.
You have
So,
over-the-counter medications, okay? Just do not forget. You have some over-the-counter medication.
which one?
Check on the screen.
Okay, just a minute. On the screen. ginseng? Okay. شفتوش. Okay, so just a minute, please. Ginseng. It seems that we can't take any herbal at this time. Okay, so
Okay.
my recommendation to check with doctor first. We don't need to any herbal maybe interact with your medication. So
Okay.
it's better to check with doctor first to make some blood work. After that, we can adjust the dose of statin after your symptoms resolve. Is it clear for you now?
Okay. Thank you.
Okay. Okay. Can I call you a few days to make sure that everything is good?
Yeah, sure. Thank you.
Thank you.
Okay. So, okay.
Yeah.
Would you like to go, doctor?
لا قول يا باشا اتفضل.
Okay, so here, doctor, we have guys like two conditions, two separate conditions. One is muscle pain, which is related to statin, and the other condition, which is the hypothyroidism. First of all, I would actually, my advice is not to use like a lot of medical terminology like hypertension, hypothyroidism, myopathy, because those are like hard language. We need to use lay language or plain English in this exam because it's part of the communication, and we will be punished if we use like medical terminology. Instead of saying hypothyroidism, say low thyroid level. Instead of saying like hypertension, like high blood pressure, and so on. Okay, so here in this case, we have like two different scenarios or two different like problems or conditions. So we need to cover each one of them. The first thing you asked everything, Dr. Hiba, you are very good, and Abdul Hadi as well. Like, why are you using this medication for, and do you take any other prescribed medication? You did a really good assessment. So let's not waste time on this. Just like you need to relate or use the reference to know exactly what is the problem here. The patient is suffering from muscle pain. It could be like myopathy because of statin, as you mentioned. Then what's your action here? You will tell the patient, you know what? This muscle pain actually may be related to the statin you're using right now. We don't know. So my recommendation is before taking any further doses of this medication, I would actually recommend like go and seeing your doctor because you may need to do a lab work to make sure this is the safest medication to use right now and the safest dose. Doctor may do like some dose adjustment. We don't know. So I wouldn't recommend using any painkiller at the moment. I would actually highly recommend going and see your doctor. Okay? Until sorry, and tell the patient that I'm going to document this in your file and fax the doctor as well about the current symptoms you have at the moment. So this is regarding the statin issue. And you can also like give a recommendation that, you know what, there are some statins which are, if you see the reference, which are like safer sometimes for people who have like a statin related problems like muscle pain. We can discuss these options with the doctor if we make sure that the problem here is with the statin you are using at the moment. Okay, this is the first scenario.
This is important question. How do you know that the problem related to statins? What type of question you have to pose here to understand?
I don't know. It's just like you can ask the patient, is there any recent like strenuous activity you did? Did you take any over-the-counter medication that may interacted? Have any recent change in your lifestyle?
Exactly.
You have to exclude
the first
any
time
other
that you
cause.
have this type of medications or not? This type of this type of muscle pain or not?
Yes.
Well, I think Abdul Hadi or Hiba asked. I think Abdul Hadi
Grapefruit.
asked
Yeah, he asked about the grapefruit. And when did it start? Yeah. And Hiba as well, she asked when did it start and how long have you been using this medication? You can go on and also ask about any recent change in your lifestyle. Have you started like any new activities or exercise? Just to make sure it's not related to anything else. It's because of the medication he's using at the moment. Okay, but you have to say, I don't know, it may be because of the medication. The best strategy here or the best thing to do is to stop using the medication, go back to your doctor, do lab work to make sure it's to know exactly what is the problem here. Okay, and there are other safer options that the doctor may prescribe for you if atorvastatin is the reason behind the muscle pain you have at the moment, and that's it. Don't say too much. Okay, for me, I would add one more thing. The patient has muscle pain, so I would actually ask about the urine. You know, muscle pain can lead to breakdown of muscles, can lead to complications on kidney like rhabdomyolysis, which may like harm the kidney. So I would ask, is there any change in the color of urine? Do you feel like is there any change in the amount of urine output? Yes or no, just to make sure his kidney is safe. This is like an additional point you can add here. For the 2-minute question, okay, I told you that I have like some issues with concentrating and tolerate cold and I'm fatigued. Okay, so
Yes.
this might be related to hypothyroidism, as you mentioned. So your question, you did ask me when was your last lab work? I told you I haven't done any recent lab work. Then you say, you know what, this may indicate that you have a low thyroid level. And this is important issue here. You have to go back to your doctor as well, have your thyroid level checked to make sure it's within normal range,
Yes.
because you might need dose adjustment. Okay, and
Yeah, but
please
the
in the
symptoms that you
future,
say, the symptoms that you say, the fatigue, cold intolerance, lack of concentration, all are relevant to, are related to the hypothyroidism.
yes, you're right, doctor.
Okay.
So here there's an important education point you can add for patient safety. Please, in the future, just make sure to do your lab work like more frequently as recommended by your doctor to avoid any health complications, as you can see here in our situation. Okay, and that's it. Then just go document all of this, fax it to the doctor, follow up with the patient. Can I follow up with you after a few days to see what did you do? Yes, please. Okay, that's it. And I told you that I eat a lot of fast food. So there's a self-care measure here. You can, this is active listening, just like to pick up some keywords from the patient and give him an answer related to these keywords. This is an active listening. I see that you are eating a lot of fast food just for your health. I would recommend if you can see a dietitian. Another point you will take, just to make sure your food is healthy, which will benefit your overall health, your cholesterol, sorry, your blood pressure and your overall health as well. Okay, okay. Have a nice day. Bye bye. Yeah, that's it.
دكتور يعني في الآخر هنقول له يوقف البروفستاتين ولا يكمله؟
لا
أنا
يوقف.
أعرف إن أنا يعني تمام.
He can stop
ده
it.
ده رد تمام إن أنا أقول للمريض يوقف علاج ولا الوضع بيبقى إزاي؟ أنا أعرف
أيوة
إن ده
طبعا.
شيء مش
we are not
سهل إن أنا
doctors
أقول
here.
له. مهم.
We are not doctors here. We don't know if this like myositis or myopathy or rhabdomyolysis. We don't know. We have to do
تمام. هو
lab
لو
work.
رhabdomyolysis السيمتومز بتاعته إن هو بيبقى فيه فيفر مع تشينج في اليورين كولر للون معين، فدي حالة إيمرجنسي، بس هو
You don't
ما
know.
قالش إن هو عنده الحاجات دي.
I know, but you
مم.
still don't know what is the creatinine kinase level in his blood at the moment. Okay, so like you are between like two choices, either to continue on this medication, which is a chronic medication. It's not like a life-saving medication. So if he stop using it like for 1 or 2 days, will not like a big deal. It's not a blood pressure medication. Okay, but if he continue using this medication and he has like a muscle breakdown at the moment, you will increase the muscle breakdown. He may be like in the stage of myopathy. You may put him at risk of rhabdomyolysis if he kept using this medication for like 2 or 3 more days until he sees his doctor. And this is another question. When can you see your doctor? Okay.
تمام ده بالظبط.
So I would actually recommend, like, before taking any further dosage from this medication, see your doctor right away, have your blood work done, okay? So the doctor can give you the best recommendation, either to continue using this medication or to decrease the dose for you or to switch you to a safer options. You can give the patient the name of the safer options if you have time, or you don't have to do it. Like pravastatin, fluvastatin, other medications
Correct.
which have less.
There's no problem if you have some suspicions.
Yeah.
If you are suspicious that the atorvastatin is the main cause behind the muscle pain, no problem to stop it. Why not?
Yeah.
Stop it, and you are gonna advise the physician about this.
Yes.
Because
Yeah.
you found out some.
Just one more point from Dr. Mohamed. If it's a doctor station and doctor call you and doctor tell you that, you know what, the lab work is creatinine kinase is less than 10%. or the condition here is just myositis. So what's your recommendation? Then here you will give, according to the reference, your recommendation, like continue using this medication or decrease the dose or switch the dose, but you don't have the lab work in front of you. You don't know what's happening inside the patient's body at the moment. So the safest option here in the exam, and you will save the patient's life, is to stop using the medication. Or just tell the patient before taking any further doses, go and see your doctor right away.
Okay, doctor, I have a question. In reference, we have drug disease interaction with the statin in case of hypothyroidism. So should I mention this to patient or just I ask him to go to the doctor?
You can mention, you can educate him about this and let him go to the doctor. Anyways, he will have to see his doctor because it's been like 2 years. He haven't done any blood work to check on TSH and thyroid, and he started having some symptoms related to low thyroid level.
Okay. Yeah.
So yes, anyways, it would be a good idea, very good idea, and best recommendation to refer him to the physician and to as well for his muscle pain. We may need to change the atorvastatin. You know that?
Yeah.
Yeah.
Okay.
بعرف ان في الغالب الدكتور في الحاله دي بيقللوا التروفاستاتين دوز وبيضيفوا الايزيتيمايد. غالبا ده اللي بيحصل في الحالات دي، صح ولا انا؟
مش
هو
دلوقتي.
stop the medication و symptoms relief وبعد كده بيرجع ياخد تاني statin بلو دوز I think. اتفضل يا
لو
دكتور.
جوزات
لا في ليها كذا استراتيجي، ليها في كذا so many protocols يعني. زي ما الدكتورة هبة قالت you can decrease the dose or you can switch to another low risk statins, or you can decrease the dose and add another medication as you mentioned like ezetimibe. So there are so
Take an
many
medication every other
different
dose, every other day. You know that?
or take every other day. Yeah, you're right.
Yeah. So there are many different.
medication. Isn't chronic medication can be taken as like dose every other day?
Statin.
It can, but it's not our
or
decision.
ACE inhibitors or something like that, because I heard someone said every other day.
Yeah, they can be used every other day. Sometimes.
Okay.
Okay.
Sounds good. Is it clear? The good way to this station is clear for you guys?
Yes, doctor.
You understand how to solve it? What's the
Yes.
hidden concern? Okay. Sounds good. So let's move on for the fourth. Yeah, Advil, Panax, ginseng, coenzyme Q. There's some anecdotal evidence for coenzyme Q10 for muscle atorvastatin or statins related muscle pain. You know that? Did you know that? Yeah, and sometimes we may recommend coenzyme Q. As mentioned, it's anecdotal evidence. You know, there is no like
What
significant
about ginseng, doctor?
for muscle pain.
Yes.
No, it will
No,
not
it
help.
doesn't have. It can be used for fatigue, but the patient is hypertensive.
يعني دكتور نظام سألني أنا ممكن آخد الجينسينج للماسل بين ولا لأ، فأنا يعني قلت له ما ينفعش لازم نشوف
لا
الدكتور
أنا كنت قصدي
ده كان رد
كان قصدي
صح؟
على الفاتيج. أنا كان قصدي على
اه
الفاتيج for fatigue and low concentration.
يعني كان صح اللي أنا قلته ولا؟
صح. If I were you, I wouldn't recommend anything. I would just like refer the patient. It's a clear referral case. We know exactly why the patient has muscle pain, and we know why the patient has these symptoms of low concentration and fatigue.
Okay, thanks. Okay.
Yeah, you'll have to explain and refer him. This is the best scenario.
Yes.
Right. Let's go station number 4.
Yes. Okay. So I will put
The volunteer. Who's the volunteer this time? We need a volunteer.
هي OTC ستيشن ولا patient ولا ايه الستيشن بتاعت ايه؟
Which one? Station number 4?
اه
No, it's not OTC. I'm gonna send you the reference.
It's a pickup. It's a pickup.
Yes. Yes, here you go, guys. You have two references.
Okay, I'll save the time.
مين اللي هيدخل يا جماعة؟ عبد الهادي.
Maybe Samuel or I don't know, the guy before Heba.
Samuel.
Samuel, yeah.
Where's
If you want.
Samuel? Samuel's not here. Okay. Any other volunteer, guys? ماشي. رافع ايدك. شوف لو محدش داخل تاني خش انت مؤمن. A new volunteer? Do we have a new volunteer? Iboka, Ibubi, Dima, Shidi.
There is two in the chat, but they ask you to unmute you.
Yes, we have Maddie.
yes.
Maddie.
I can try.
Maddie? Are you a Maddie?
No, Nuela.
Yeah, hello.
Yes,
How are you?
Let's go.
So you got the reference with the WhatsApp group? What Telegram group? Sorry.
Yes, I'm just looking at it now.
Can see it?
Yes.
Okay. So Nezam, can you please watch the time?
Yes, sure, doctor. I'll give you a Maddie like 30 seconds.
They'll give you, they'll buzz you when it's 5
And
minutes.
the reference, okay?
Well, can I see the question for? I thought I'm supposed to see what it's about before I look at the reference.
Yes, just like a pickup case, and you have the prescription. You will have the prescription in front of you. Like if you scroll down, you will find a new prescription below the patient profile.
Okay.
Okay.
Okay. Are you ready, Amadi?
I can't see the question, but go ahead. I'll just try my best. Anything. I'm just trying for the first time. So.
Okay. Let's get started. Okay.
Yeah.
Yes. My name is Fatin. I have a new prescription. I would like to pick it up.
Okay. You're welcome. You're speaking with Casey, the pharmacist. You're welcome. Please take your seat.
Thank you.
I just want to, I'd like you to know that you are in a private area and everything you say will be treated confidentially. Can I just ask you 1 or 2 questions so we can have the direction in which to take here? Okay. Please, can we start with your name and your age?
My name is Fatin. Yeah, my name is Fatin Hamama. And I'm 47 years old.
Okay. So what brings you to the pharmacy today?
As I mentioned, a new prescription here.
Okay. All right. I have a copy of the profile here. All right.
Sure.
So, okay. From the prescription, I can see that the doctor prescribed Vyvanse, amitriptyline, and elytriptan for you. Can I ask you what exactly you told the doctor before he gave you these drugs?
Before I get, it's for the hot flashes.
Okay, I see.
The hot flashes, yeah.
Okay. And I also want to ask you some other lifestyle questions.
Yeah,
Do you
sure.
yeah, please, do you smoke?
Yes, I do.
Okay, like how many
10
cigarettes takes
10.
do you take per day?
10 per
10
day.
per day. Wow. Okay. And do you take alcohol?
No.
Okay. Do you have any underlying medical condition, besides?
Yeah, I'm taking the medications on file here. You can
Okay,
see
just okay, but you don't have any other medical conditions like hypertension, diabetes, nothing of that nature.
Oh, no.
Okay. All right. So, like you said, like I can see you were prescribed estrogen for the hot flashes, given estrogen, and the reason for that is because it takes care of some, you are 47, you're in the period where you have some menopause, you can experience menopausal symptoms, and so it's part of the symptoms you get at such an age, things like this hot flashes like you complained. So the drug that you are given, estrogen, it will help in the treatment of those kind of symptoms. So it will help to take care of it. So that's why the doctor prescribed it to you. So you're expected to
Yes, to have a better lifestyle.
yes, it's going to help you to take it. Like, of course, once symptoms are taken care of, you have much relief. But you also need to know that there are some 1 or 2 side effects you might get. I'm sorry, I'm not understanding this reference. I'm trying to understand it, but I can't see what to say. Can we
Can you see
please
the
end? I've lost. I don't know what to say again.
Can you see the file on the screen or not?
The one on the screen. I'm juggling between pages. Yes, the Vyvanse, I can see that.
Yeah, B.Pharm's.
Mm-hmm. Yeah.
This is a patient profile.
Mm-hmm. But I can't see, Vyvanse is not really telling me what's inside Vyvanse. I'm assuming it's this estrogen therapy, but I don't really know what the generic name is for Vyvanse.
Ah, you don't know it. Okay.
No, I don't. I've not worked in the pharmacy.
Stimulant. One of the stimulants. Amphetamine, I believe.
Okay, let's see.
Less dexamphetamine.
Yes.
Yeah, less dexamphetamine.
So why would they give you amphetamine when you said it's just hot flashes? I'm wondering.
Okay. Would you like to pose a question?
To ask you the question. I asked you say you have no other medical conditions, so I'm at a loss here.
2 minutes.
Okay. So would you like to continue it or
No, I'm done. I don't know what to
here?
say. Yes,
Okay.
please.
Okay, perfect. So no problem. Okay, let's try Amadi. Let's start with another. Let's retake the station. Let's retake it, guys. We have Dima. Yes, Dima. Let's go. Dima Abdullah.
Yes. Hi.
Yes, how are you?
Let's start.
Yeah, let's start right away.
Okay. Okay, go ahead. Go ahead, Dima.
Hi. My name is. Go ahead.
Yeah, start. Yeah.
Hi, my name is Dima. I'm pharmacy at UT today. How can I help you today?
Yes, I have a new prescription here with you guys. I would like to pick it up. My
It
name
is
is Fatin Amama.
sure. I will do my best for help you. This is a prescription for you.
Yeah,
What the reason the doctor prescribe you for this prescription?
I have hot flashes.
Okay, it's sympathetic for you. I will do my best to help you.
Yeah.
Can I get you? Can you have a seat in our private counseling area to ensure everything we discussed keep it confidential?
Sure.
Okay. Can I get your name and age, please?
As mentioned, I told
Oh,
you.
okay. I could. Okay. Sorry. I pull up your profile.
Yeah.
Okay. I just need to go through your profile to give you best recommendation. Your
No
profile.
problem at all. Go ahead. Here's my file.
Okay. You use Vance 20 milligram capsule.
Yes,
For what
dextroamphetamine
reason you use it?
for concentration.
Okay. And it's controlled right now? Your
Yeah,
concentration
it's
is
good.
controlled?
It's good, yeah.
Okay. And you use amitriptyline 10 milligram. Okay. 2 tablets, 1 daily at bedtime. For what reason you use it?
For which one? What type? Yeah, amitriptyline.
Yeah.
Yeah, it's for migraine. To
Okay.
prevent migraine attack, yeah.
Prevent migraine attack. Okay. And you have it with you, aura without aura?
What do you mean?
Like, do you have before attack a flushing, sensitive to the light, before you get a migraine
No.
attack?
No, I don't.
You don't? Okay. And as well, we use elliptriptan 5 milligram for what? For same for prevention or treatment attack?
Treatment.
For treatment. Okay. Okay. So can I ask you a few questions
Here's the
about?
prescription. This is a new prescription that I have.
Okay. Can I ask you a few questions about your lifestyle, as sometimes lifestyle affect your condition and how they can use?
Yes, go ahead.
Okay. Do you smoke?
Yes. 10 cigarettes per day.
How much?
10.
10? Okay. Are you thinking for a quit smoking?
No.
No. Okay. Did you drink alcohol? Do you drink alcohol?
Not so much.
Not so much. How many cup per day?
No, occasionally. Only on occasion.
Do you have time for exercise?
Not really.
Not really. Okay. Can you describe your diet?
It's well-balanced diet.
Well balanced. Okay, keep up. Are you pregnant by any chance?
No.
No. You're vaccinated up to date?
Should I be pregnant? Okay. The vaccines, yes.
No,
They are
okay.
up to date.
Okay. Okay. So, the doctor prescribed for you this drug, estrogel. Can I go to the reference and come back to you?
Yeah, take your time. Okay.
Okay, thank you for patiently waiting. Okay, the doctor prescribed for you estrogel gel. Use it intravaginally, and you will have some side effects like just 1 minute.
2 minutes.
Minutes remaining?
Okay, maybe you have some side. Okay, and you will be
Yes. Yes.
Okay, the doctor prescribed for these drugs for this your symptoms. It's typically used for external use. You will be like maybe you have some side effect like irritant, but will be good. Going with continuous use. Also, if you have if you have any side effect like anaphylactic reaction, short of the breath, don't use any this medication and go to the emergency. As you have to monitoring any side effect like abdominal bleeding, fluid retention, severe headaches, mood change, you have to go to the emergency as well. And there is some self-care measurement you have maybe it's good for you like try to take off heavy clothes, use it divan, and to wet your try to make exercise and relax exercise and water. That's it. That
Okay.
makes sense for you. Okay.
Everything.
Thank you for
Thank
choose
you so
our
much.
pharmacy. Can I give you a call after 2 to 3 days to check how is your medication going with you?
Yeah,
أيوة.
perfect. Thank you so much. Okay, sounds good. So,
Okay.
yeah. For me, I don't know. Yeah, you missed several points. Okay, you missed several points.
Yeah.
What do you think?
عرفت أطلع side effect ما عرفت أطلعها من وين ما طلعت معي
والله what?
side effect
Side effect of what?
The new
للدواء.
medication.
Have you checked the reference of the medication?
بس بين لي side effect للأورال ما بين لي طلع الجل.
Okay, gel. How we use the gel? Intravaginal.
Passing the maybe ما شفتها.
No, it's not intravaginal. It's 1
In the
pump.
prescription.
Market
Oh,
here.
on the skin.
1 pump continuously once daily at bedtime. Okay. So yeah, let's start by assessment. Your assessment. What do you think? How do you find your assessment?
Bad.
Why?
مش عارفة ما الريفرنس
You asked some irrelevant question. Okay, like asking for this. Asking for pregnancy. She's 47 years old. And she
42 أنا بعرف. Okay.
There you
She's
go. And you haven't
menopause. She's already menopause.
Yeah. Okay. So yeah, no problem. So pregnancy, make sure please. This is irrelevant question. Okay. So she's menopaused and she's 47 years old.
Oh my God.
They need to ask about pregnancy here. Okay.
Okay.
This is very important. You this is the Vivant. You missed so much time. I believe that you missed so much time. Yeah, like repeating Vivants, etc. 1 times daily, and that I don't know. So you should go very fast on that. Vivants, you are taking 20 milligram for what reason? That okay. Afterwards, amitriptyline for what reason you are taking that? Elatriptan, etc. Okay. So what about migraine here? Is migraine a contraindication with this patient?
لا
Why?
ما شفتها بالكونترا انديكيشن.
ما شفت الميجرين في الكونترا انديكيشن؟
أنا بعرفها المعلومة من الام سي كيو بس أنا ما شفتها هون.
No, it's in the you're gonna find it in the reference. Migraine is contraindication with HRT, hormone replacement therapy. Correct?
It's
Yeah.
So you asked it for migraine with aura or not aura, or not with the aura, right? For what reason you asked this question?
لأنه إذا ما كانت without aura we can't give it to the patient الأستروجين. It's with aura only contraindication.
You're right.
Okay, but you didn't mention anything about that.
She did actually, doctor, sorry.
She
She did
asked
ask
about
you,
migraine, right?
no, she asked you, do you have any symptoms before the migraine attack, like blurred vision or
Yes, but in the
other
conclusion,
symptoms?
when I ask it here now, when I ask it here now if
Yeah.
migraine is contraindication, she said that she didn't see it in the reference.
Yeah.
Okay, so it's marked in the reference. Okay, you asked a very good question about the migraine. Is it with aura or not with aura? The patient will not understand this, so you will have to explain if there is any neurological implications or any problem in speech or any etc. Photosensitivity, anything. So yes, you have only just to explain that in the lay language. Okay, this is number one. Number two, we have a very important point here. The patient was prescribed estrogel.
Yes.
Should we give estrogel alone or should we give
Or what's progesterone
with it?
No, give progesterone because she has intact uterus.
We don't know. You didn't ask her.
No,
Did you
gel,
ask
it is
him?
gel. It's only gel. After 1 year, we can give a combination.
After what?
1 year.
You can give combination?
I was remember from MCQ. It is can use it in women have a uterus for 1 year. Otherwise, we can give it combination with the progesterone.
Yeah,
What
that's
are-
why, doctor, we have to stick to the reference in front of you. Don't depend on your own knowledge. The reference may tell you something like completely different,
Okay.
and you may be like counted for giving a false information.
You didn't
So
ask. You didn't ask for either she has an intact uterus or not,
Okay.
right? Okay, so this is an important question. Here with this case, nothing serves against giving progesterone, correct? She was prescribed the estrogen. She has intact uterus, and yes, why not to try the progesterone to give the progesterone one, the productive one, the protective one. Okay.
Okay.
So progesterone is very important here, guys.
Yes.
Don't forget this, please. Migraine is not a contraindication here because it's without your aura. So many patient is taken estrogen with migraine treatment without any problem. Okay.
So in this case, doctor, sorry, I think we should like fax doctor regarding progesterone.
Definitely, yeah. Fax.
So you will just tell the patient, you know what, you need progesterone as well while using the estrogen, just to protect your uterus from developing what we call like excessive layers. You don't have to say endometrium or something, or to protect you from uterus cancer. So I would fax your doctor regarding this to prescribe the progesterone to use it along with the estrogen, and go and continue dispensing the new medication. It's okay.
Yeah, correct. This is correct. Okay.
Sorry, doctor, I have a
don't think
question
that
here.
we don't have any other concern here. Yes, go ahead.
Yes, please. Why we discuss about appropriate medication if there is no note there is a drug related problem. I think it's a new prescription and the doctor already assessed and diagnosed and he knows everything about if she has intact uterus or no, or we have to do that in each case. However, it's
No, we
written.
have to do this, doctor, even if it's written like no drug related problem. I think you mean this is what you
Yeah.
mean.
Yeah.
No, but you need to make sure this is the safest option for the patient. this is the correct dose. What do you think, like if the patient came with a prescription for amoxicillin and the dose is not correct according to the patient's suite? You will hold the
So
prescription.
so if he has a prescription for amoxicillin and we have to assess from the beginning, so we have to ask for the red
No,
flags
just
and
like
everything.
no, not like this. Just like, what is this for? Okay, what is the patient weight, for example? Okay, just to make sure it's the right medication for the right indication and the right dose.
Okay.
دكتور بس
You
لو
need to
على
do it.
لو الدور نوت يا دكتور مكتوب عليها no drug related problem، هي اللي مفيش داعي نعمل assessment ونتعامل على ان الدراج
هو
صح
المقصد
مثلا،
دكتور، انا مع حضرتك، بس انت مش هتعمل اسسمنت ان دي حاله مينيبوز. مش هتروح تقول لها انت عمرك كام، اخر بيريود كانت موجوده من امتى، عدى عليها قد ايه. ده انت محتاجه فعلا اسري. انت مش هتعمل كل القصه دي، هي اوريدي اتعملت خلاص. بس you need to make sure this is the correct medication, correct dose. That's why we check the reference. Maybe the doctor missed
حتى لو
something else, like he missed the progesterone here in this case.
حتى لو مكتوب على الدور نوت ان no drug related problem.
نعم, you need to still make sure this is the correct thing. Okay.
I have a quick question.
Drug related problem. Yeah.
And that's why we check the drug interaction as well, like if the patient has
drug interaction.
profile.
Yeah, drug interaction is another thing. You mean drug related problem is not drug interaction. I have to check drug interaction, maybe drug disease interaction. Yeah, but drug related problems that this medication has been it's the best option for the patient. That I understand that.
I believe,
no
I believe
problem, yeah.
No drug related problem. It means that the patient can use this drug for this condition. This is what it means. There's no drug related problem. But there may be like something missing the patient should take along with this medication. Or maybe there's like a dose adjustment that has to be done. But when it comes like to this is the right drug for the right condition, yes, it is. This is the right drug for this condition. You don't have to do an assessment to make sure it's the right medication for this condition. But just you need to make sure if the patient needs something else along with this medication, or is this the right dose, you have to double check on this.
Yes.
And just, Dr. Mohamed, I would love to add something here. Dr. Bima, you didn't tell the patient, how to use the estrogen dose. If you open the reference, page number 3, you will find how to use the dose. Like if it's 1 pump, you have to apply like 1 pump to both top and bottom of one arm, from shoulder to the wrist. You have to say it like this. You don't have to explain it, just read it as it is. And below this table, you will find some very important information you have to also mention, like this medication shouldn't be applied on or near the prestus or on the vulvar region. You should allow allow like 5 minutes before covering the skin with clothing. All of these are very, very important.
You have to give counseling. You have to give
like counseling. Yeah, you're right.
It's not intravaginal. Okay, one of the colleagues say that it's intravaginal. No, it's not intravaginal. It's subcutaneous. You can apply it on the upper arm. Do we have to alternate the site of application at every time or not?
Sure, we have to. Sure, we have to alternate.
You have to alternate what?
I mean, we have to mention that she should not apply the gel in like area like wrist or something like that. I think we have to mention that.
Yeah, she can apply it in her left arm every night. That would be okay, or should we alternate? Okay. For estrogel, no need to alternate. She can apply it at the same time every day. Okay, that's it. Yeah, she can do that. So, but you're still needed to give a counseling on that. Okay, the main therapeutic problem here is with migraine. We agreed that without aura, there is no contraindication. She still can take the estrogen without any treatment, without any problem, sorry. At the same time, the other concern is the progesterone. Progesterone should be added. Yes.
Okay, just to be clear, please. So what information are we meant to get from the HRT reference?
Sorry, repeat that, please.
I said, what information are we meant to get from the hormone replacement therapy reference?
Yeah, the other one.
Contraindication.
Just talking about the other reference.
Yeah, contraindication is very important. In any monograph, guys, or any reference, I'm talking about the monograph of medications. Usually the most important parts are the warning, okay, warning and serious advices or something like that. Warning is very important. Administration, dosage, and contraindications. Usually you will have to check this 4 types in any in any monograph. If you have a new monograph or something, go to check this point. Administration, dosage, and what I said, warnings, yes.
Contraindications.
Warning. Precaution and warning, yes. Precaution and warnings.
Okay.
Okay.
Just one more point here, Dr. Mohamed. Dr. Dima, you did very good with the monitoring, like the severe abdominal pain and eye pain, but the pain here is already have a migraine issue. So I would love to stress on this point, like if you have any severe migraine attacks, unusual migraine attacks, don't just say like if you have like any headache, because he already has she already has headache. But if you feel like there is a change in the frequency of the headache attacks, the severity of the headache attacks, maybe something serious. You need to contact the doctor regarding
Yes.
this. Okay,
Correct.
just don't just say headache because she's already has headache. Okay, just to rule out any clot issues, any blood clot issues. Yeah, and that's it. Yeah.
Perfect.
Well
Please,
done.
I have a question.
Any questions?
Hello, I have a question.
Yeah.
Yeah, so I don't know, with the person being a smoker and above 35 years, I don't know, is it still okay going ahead to dispense it, or without the patient that will fax the doctor to confirm because of the estrogen?
Yes, smoking is a concern here. Yeah, you're correct, but you have to offer the smoking cessation protocols. Yeah, one of the smoking cessation protocols.
Okay, so we
I
offer
think
it
Doctor.
and still dispense the medication?
You
Yeah, I
can. You
think
cannot dispense
she's
if you want
meaning,
that.
sorry, Doctor, I think she's meaning smoking is contraindication here for using estrogen.
Yeah.
It's
So
not contraindication. It's contraindication only for people, if my memory serves me well, over like 35 years and using like more than 15 cigarettes per day.
Oh, I thought it's greater than 35 and smoking for estrogen.
It's just using like 10 cigarettes per day.
Oh, okay. I don't know.
And so it's not contraindicated.
My concern is,
but it's a concern here, and
it's a concern.
You have to offer quit smoking as smoking
cessation. But it's not contraindication.
because on the reference, there's no smoking in the contraindication part. So are we meant to work with the reference or based on, as in what we know? That's what I want to clarify.
Okay, contraindication in the reference.
Yeah.
Migraine with chronic liver, active or history of blood clotting, active deep venous thrombosis, known suspect history of breast cancer. Which reference are you talking about?
I'm looking at the extra gel reference.
indications known are past breast cancer, known or suspected estrogen-dependent malignant tumors, undiagnosed genital bleeding, endometrial hyperplasia, previous or current venous thrombosis, known thrombophilic disorders, active or recent arterial thrombosis, acute liver disease, known or suspected pregnancy, lactation. I can't see this is the smoking.
Yeah, so there's no smoking, there's no migraine. So do we work with what we can see on the reference or based on what we know?
Just go with the reference in front of you.
Okay. All right.
Just stick to the reference.
Doctor, I have a question also. As Dr. Mohamed said that we have to ask if she has an impacted uterus or not. So
Yeah.
why this question is important?
Because estrogen, if you use estrogen in people who has uterus, estrogen alone can increase the growth of the inner layer of the uterus, can cause something called endometriosis, which can develop uterus cancer. Progesterone prevent this from happening. So that's why any woman with uterus, intact uterus, she has to use a combination of estrogen and progesterone. But if she doesn't have a uterus, if she removed her uterus, she can just go and use estrogen alone. No need for progesterone.
Okay, thank you, Doctor.
Okay, guys.
You're welcome. Okay.
Yeah, I think we're good now. We're good to go. It's been like
Yes.
3 hours now. Yeah, so long.
Okay.
Thank you so much for your attendance. The session will be uploaded to PharmaFree YouTube channel. Okay, guys,
Okay,
ladies
thank you
and
guys.
gentlemen,
Thank you, Dr.
thank you so
Mohamed.
much. Thank you يا نظام. شكرا يا نظام يا جميل.
شكرا يا دكتور.
Oh, but you have the whole schedule, guys. The whole schedule is in the Telegram group. You can check when will be the next session, inshallah.
إن شاء الله.
Okay.
شكرا
شكرا
دكتور.
دكتور.
على خير.
دكتور الملف هتنزل لنا اياه على الجروب ولا لا؟ بس هنرجع
Yes.
نشوفه اوكي تمام، يعطيك العافية.
الملف what do you mean by ملف?
هذا PDF
Okay.
الكيسز اللي عملناها اليوم.
Yeah, you have it already in the group. I sent it already.
والله اوكي ما انتبهت.
You can see
شكرا.
it. Yeah. Okay.
Okay.
The session,
تمام.
Okay.
yeah, the recording will be uploaded to the YouTube channel. Thank
Okay.
you, guys.
Good night, guys.
Bye
Goodbye.
bye.
See you. Bye for now. Bye.
Bye.
Bye.